uh,
Just,
e-conference. Today we embark on a
just for,
journey into the. Yes,
ma'am,
sir. I am.
just
Should I
for
start?
the consent, it
Yes.
is to inform you all that this meeting will be recorded for future references for the consent to all. Thank you, ma'am. Please go ahead.
Thank you, sir. So I extend my warm welcome to all the joinees of this today conference. Yesterday we had seen was many innovative and these poster presentations in the form of the virtual gatherings which served as collaboration, innovation and knowledge exchange among forensic professionals. Now we come together to commemorate the Forensic Medicine Day. We celebrate this remarkable advancement made in the field and recognize the tireless dedication of forensic experts who play a pivotal role in unraveling mysteries and delivering justice. So today we encourage you to actively engage with our esteemed speakers, participate in the interactive session and seize this opportunity to expand our understanding of forensic medicine. On behalf of the whole organizing team, we extend our heartfelt gratitude to all participants, speakers, sponsors, and supporters who have contributed to making this e-conference. Now, I think I will go on for the to the slide presentation. So, can please allow me to share these slides.
Yes, you can share, doctor.
So, my slide is visible.
Yes, ma'am.
So we go on that this is the our collaboration with Mexico Colegio Federal de Patrios, LAFIMS Association.
We started to declare that every year on 12th May we will celebrate.
Vision of LAFIMS Academy to uplift the status of forensic medicine, investigative medicine, and allied health science nationally and internationally by promoting mutual interaction between stakeholders for the advancement of relevant scientific knowledge. Our intended learning outcome includes understanding of global advancement and recent trends in the field of forensic medicine, forensic sciences, and allied health sciences. To know how forensic dentistry as a method of human identification can be used and applied in gaining knowledge. To work with mastering crime scene evidence collection, handling, and preservation, a very important part of our field. To understand virtual autopsy advancements in postmortem imaging techniques, and to know about forensic genomics, advanced DNA profiling with next generation sequencing, handling of medical legal cases in clinical setups, including patient related legal complications. So these are our vision partners, our business collaborators, support collaborators, and this is the event details for today and yesterday. We warmly welcome our organizing committee, our chairperson Dr. Vijay Pal sir, President GLAFIMS India, and our General Secretary Dr. Chaitanya Mittal sir. And myself, which is I am today with you as a part of organizing secretary. I am head in the Department of Forensic Medicine at Sarojini Naidu Medical College, Agra. Sir, if chief guest is available, can we invite sir?
I think, ma'am, first we have.
Yes, I put you are good.
Dr. Mukesh Yadav sir is already presiding over the National Forensic Medicine Day, which has been organized by the executive of the IAFL. He is busy there. He'll take some time.
So what we will do, this
Forward that you are a fighter and a fighter to the end.
Yes, we can welcome the guest of honor.
You in Uttar Pradesh.
Okay, sir. That will be fine. So, sir, we would
First-
invite our guest of honor of this event, Professor Dr.
I think,
Kamoda
Dr.
Prasad, sir.
Dr. Icha, I think there's some minor changes in the program.
Yes, sir.
Yes. First, I think Dr. Vijay will be presenting, and then Dr. Carlos. After that, Dr. Kamoda and Dr. Mukesh.
Okay, fine, sir.
So Dr. Vijay will be starting.
Sir, can you please lead this for Dr. Vijaypal, sir, introduction?
Dr. Vijay, sir.
Yes. So I'm stopping my screen, sir.
Yes.
So please, we invite probably our President GLAFIMS India, Dr. Vijay Pal sir, to start up the program for his blessings and a welcome note, and with the brief bio of sir.
Dr. Vijay, sir. Unmute yourself, sir. Yes, sir. Please.
First of all, I thank the patron of the GLAFIMS for organizing 2 days conference, international e-conference. And this particular day is to commemorate the Indian Academy of Forensic Medicine Day, which was established on 12th May 1972. And in 2022, we celebrated the Golden Jubilee. And it was decided in the national conference that will be holding the National Forensic Medicine Day on 12th May every year. And this is the third time that we are celebrating the National Forensic Medicine Day in India. And with that objective in mind, the GLAFIMS India has organized this international e-conference, which was held yesterday also on 11th May 2024. And today is the second day. And yesterday we had 7 lectures, invited lectures, and today we have got 8 lectures. And I welcome all the attendees, all the speakers, all the chairpersons, and all the chief guest of honor, Dr. Kamud Prasad Saha from GLAFIMS Bangladesh, and our president, Dr. Mukesh Yadav, who is busy in the national program which he is presiding over. So I welcome each and everyone, and we can start with the presentation because Dr. Mukesh Yadav will take at least half an hour. He'll be free at around 5 p.m. So we can start our program, means we can take up the further things. I hand over the mic to Dr. Imran.
Thank you, sir. So nice of you. And thank you for giving this opportunity to me work on your behalf. First of all, thank you, Dr. Isha, for nice introduction, opening remarks for the conference. I request all the participants to join the WhatsApp group if you have any issues during the conference. If you face any difficulty technical, so please you can mention it to us. We will solve the issue. So, as already introduced by Dr. Icha, Dr. Icha is the organizing secretary and our chairman, sir, and secretary, Dr. Chaitanya. For today, our chief guest is Professor Mukesh Yadav. He is the president of the Indian Academy of Forensic Medicine, the biggest and the oldest association of forensic experts of India. And our president, sir, is a very energetic person who is principal of NC Medical College and also working in medical education and Uttar Pradesh Medical Council. He has a vast experience, and today, as there are so many programs going on, and our sir is invited at many positions. So, but I requested personally that you should spare some time, at least 5-10 minutes. So he promised. So I hope he will join us soon to give the chief guest address. So before that, we will finish all the other presentations. Our guest of honor today is Professor Kamodo Prasad Saha, sir. He worked as a director of medical education, Director General Medical Education, Dhaka, Bangladesh. He's a professor and working as professor and treasurer at Sheikh Hasina Medical University, Khulna. Also worked as a director of Faridkot Medical College Hospital, Faridkot, Bangladesh, and worked as professor and head in Department of Forensic Medicine, Comilla Medical College Hospital, Comilla, Bangladesh. So he is the uh, one of the leading forensic expert as well as medical educationist of Bangladesh. And it is our pleasure that GLAFIMS uh, has got him to head the GLAFIMS Bangladesh under his leadership and direct commands. So then our special guests include Dr. Victor. Uh, he's from Mexico. He is the president of Colegio Federal de Peritos, Mexico, and also heading the GLAFIMS Mexico. But the time at Mexico is a little bit early in the morning today. So he will be joining in the late hours to us because of time difference between India and the Mexico. Our next special guest is the Dr. Carlos Cuadrado Gomez Serralinos. He is a judicial and forensic expert and president of uh, Professional Association of Criminologists of Spain. Dr. Carlos maintain a very remarkable website, but the issue is it is in Spanish, and so we have to translate it to English before understanding that website. So next is our office bearers. These are our office bearers. All of you know, except Dr. Seema is the vice president and Dr. Afzal Harun is the treasurer of the association. Then we have senior advisors for the GLAFIMS India, Professor Pragnesh Parmar and Professor Ashok Chanana, sir. Professor Ashok Chanana is the chairman of the advisory board, and Dr. Vasant Nayak is the member of the advisory board. Our today's program is opening by Dr. Richa. It is done already. Then we have Dr. Vijay sir. And our next is the Dr. Carlos will be presenting GLAFIMS Spain. And then Dr. Komodo Prasad Saha sir for the guest of honor address. And in the last, Professor Mukesh Adur will be heading, addressing us as the chief guest for this session 4 of the conference. Today we have the following topics to be presented in the conference. Present status of forensic medicine in Bangladesh, global advancement and recent trends in forensic medicine, mitigating medical negligence, striving for excellence in patients' care, recent advances in forensic foundation, mastering crime scene, evidence collection, handling and preservation, drug tracing, and forensic science in Zimbabwe, forensic dentistry and as a method of human identification, and globalization of the Indian forensic medicine, an initiative marked in the history of forensic medicine. Our key presenters include Dr. Oscar Manuel Hernandez Cueros from Mexico, Dr. Rakesh Kumar Goria sir from India, Professor Dr. Komodo Prasad Saha sir from Bangladesh, Dr. Richa Gupta from India, Dr. Amarnath Mishra from India, Dr. Bhupesh Kumar Sharma from India, Donald Mushave from Zimbabwe, and myself, Dr. Imran Sabi. I am talking to you from Saudi Arabia. These are the key speakers for today. And we have scientific committee, which includes our chairman, sir, chairman of the Quality Assurance Committee, Dr. George Paul. Sir, he is the branch director and senior consultant working in Singapore. and also working for forensic radiological aspects as well. Then we have co-chairman, our Pragnesh Parmar, and we have overseas collaborator Josepina Sapini, Vice President of Forum Lexus Association. Then we have international reviewers, Dr. Muhammad Hakim Hosham. He is from Malaysia. Dr. Sibte Hadi is from Riyadh. Professor Nasimul Islam sir from Malaysia. And scientific committee continues. Dr. Parmod Goyal from India, Dr. Pooja Rastogi, Dr. Seema Sute. The quality assurance committee for this conference, these are the 5 members of the quality assurance committee. Maybe 1 or 2 is not available, but 3 are available. So these 3 will be the quality evaluator for today's session. Other committee members includes Dr. Carlos, Dr. Hadi, Dr. Yakubo, Victor, Gaurav, Garima, Fatima, Seema. And also all the committee members of the organizing committee. The program methodology that we will adopt today will be the interactive presentation and group discussions. So this is the first session we are going on. And this is the program for today. And regarding the forensic medicine day, Professor Mukesh Yadav will be telling us more. And these are the presentations by the presenters. So thank you. Together we will succeed. And after the seminar or after the conference, there will be a quality assessment form will be sent to all the participants to reflect on. Don't hesitate in asking questions. And this is all from introduction. So with this, I would like to invite Dr. Carlos Cuadrado to share his views and presentation.
Okay, hello. Thank you for introducing me. I will try to share my presentation. I think it's like here. Okay, let me check. This is okay? You can see my presentation? Okay. Can you see it?
Yes, Dr. Pan.
Okay. Okay, perfect. So first of all, I want to say sorry, as only this time, I will introduce my presentation in Spanish, because there will be a lot of people from Spain that is going to see that after hours, and maybe for the Mexican people. So I made my presentation in English, but I will stay translating into the Spanish. So I am sorry to speak in Spanish, because most of you
No, it's
speak
okay.
Okay.
We can read it from here.
Okay.
So while talking, you just display the same image. Okay.
Okay, perfect. Okay, thank you very much.
Thank you. Yes.
So, buenos días y buenas tardes a todos, queridos amigos. Espero que todos estéis bien. Y nada, pues en primer lugar quería presentarme tras todo este tiempo de conversaciones y bueno, pues chateos, emails, WhatsApp. Mi nombre es Carlos Cuadrado Gómez Serranillos, trabajo de perito judicial médico forense en España y bueno, me voy a presentar como miembro para España de Glefims y voy a presentar a mi equipo profesional. Entonces, como muchos podéis saber, pues aparte de dirigir la parte de la división española de Glefims, nosotros nos dedicamos como expertos criminólogos y expertos forenses en todo lo que es el ámbito judicial. Es decir, lo que hacemos es contribuir para que los juzgados o profesionales judiciales
Unmute yourself. Yes.
Ok, perfecto. Bueno, repito, había un pequeño error. Como muchos sabréis, pues bueno, yo dirijo la parte de Graphics para España. Aquí nos dedicamos al apartado judicial, principalmente pues para hacer de peritos expertos entre lo que es las personas que pueden tener un conflicto judicial y los jueces. Es decir, el perito lo que hace es explicar en términos no tan técnicos la parte, digamos, de la medicina forense que tiene que explicar y comprender los tribunales. Aquí en España, nuestro equipo está formado tanto por mí como por Marta Perales y Noelia Gatel, que es la presidenta ahora mismo. Son estas dos, son mis compañeras, they are my partners. Noelia es psicóloga, criminóloga y diplomada en medicina legal. Marta es criminóloga y graduada de medicina legal y forense. Y bueno, pues juntos trabajamos en todas partes del mundo, tanto en español como en inglés, para poder colaborar a nivel judicial. Nada, simplemente pues agradeceros que formamos parte de este grupo. Esperamos que todo este año 2024 podamos tener colaboraciones futuras en conjunto. Espero que sea una experiencia tan grata para nosotros como para vosotros. Y bueno, simplemente por no hacer esto más largo, quería que antes de terminar explicaros bueno, quien tenga algún tipo de pregunta o quien quiera hacer cualquier consulta tiene a su disposición, perdón, tanto mi WhatsApp como mi email. Y bueno, estaremos encantados de ayudarlos en cualquier contexto, tanto a nivel forense como a nivel de criminológico. Bueno, cualquier duda que necesitáis o si precisáis que viajemos, sabéis que estamos encantados de colaborar con vosotros en ese sentido. Y por último, para cerrar, pues simplemente quería daros las gracias por toda la atención que he recibido hoy, que es un honor formar parte de este equipo tan estupendo, tan dinámico y tan cualificado, y que, como ya he reiterado previamente, pues espero poder colaborar en el futuro con todos vosotros de mayor o menor medida. Así que nada, simplemente thank you to everyone. And this is my Spanish team, so we are the Glephins Spain. And this conversation was only to introduce yourself to everybody. So thank you very much, and thanks to stay here. Yes,
Thank you. Yes, thank you, doctor.
it
So
was
it
only
is.
a short presentation, but I want to introduce myself and my team to you. So in next meetings, probably we will stay together the three, so we can chat.
My question is that in your background, I see one of the image.
What? Can you repeat, please?
In your background, I see
Yeah.
a image with a scalpel in the chest.
Ah, yeah.
Can you tell us more about this?
It's a recipe locator.
Yes, this was a composition from I think was like 6 or 8 years ago. This was one of when we started to work in Spain. This was our first case. So this is part of the first case we have to work here in Spain, and this is a very good image. So we put in all our backgrounds and also in the website. So we are proud of that picture.
Thank you, Dr. Carlos, for introducing the GLEFIMS Spain team. And I hope your team is now ready to take over.
Sure, we are ready to go there and visit you.
So we need to just send all the names and all these so that we can approve at our end and start functioning.
Sure.
And also we need to plan some international conference in near future at any site, maybe within 1-2 years. So we need a big team of all the contributors.
Okay.
Yes, thank you.
Thank you very much.
With this, we can go to our next presenter, the Dr. Komodo Prasad Saha, sir. Yes, Dr. Komodo Prasad Saha, sir, please share your presentation. Okay.
Thank you very much.
Yes.
Good day and good afternoon. Actually, I don't have any presentation for this level. I have a presentation for the next level. Just
Okay.
I have to talk something.
Okay, it's okay. You can yes, as a guest of. Tell us your 2-day experience with GLEFIMS.
Yeah, of course. Actually, First, I want to express my gratitude for the National Forensic Day of India. Actually, yesterday we saw some very good and interesting presentations. We passed about 6 hours together from different parts of the world. We learned and enjoyed a lot. Modern technology has brought this scope and made easy. As I can understand, there is no way except making us familiar with modern technology like artificial intelligence, robotics, virtual autopsy, etc. I must appreciate organizers, panelists, and participants for the patience that they showed yesterday. It was 6 hours yesterday. I'm amazed to see the enthusiasm and interest shown by the young presenters. Today, I am very happy to introduce with Dr. Carlos Corrado from Spain. I think today we are again going to have another interesting presentations. And I think again we are going to learn and enjoy a lot. Actually, today we have another 8 presentation as mentioned. Thanks to Glavins and College Federal of Peritos, Mexico for arranging such an important conference for forensic people worldwide. I think and hope Glavins will continue and arrange this type of event in future also. Actually, no word is sufficient to appreciate Dr. Imran Sarvi for his endeavor and work. Special thanks to Dr. Imran Sarvi. In Bangladesh, we have found the GLAPIMS and I have sent you all the details of the GLAPIMS Bangladesh committee. And we are trying to go forward. And I hope in near future, we will arrange some events like this in Bangladesh. In 2019, we arranged a international events here in Plums, Bangladesh. In Plum, Bangladesh is an Indo-Pacific Association of the Law, Medicine, and Science, and we arranged here. And I think we'll arrange such an event again here with GLAPIMS. Finally, all the best wishes from all from Bangladesh, and thank you all again. Thank you very much.
Thank you, Dr. Professor Komodo Prasad Saha, sir. Now I have with us our respected chief guest, Professor Mukesh Yadav, and I am greatly thankful with the core of my heart that you have spared time despite your ultra busy schedule. Yes, the dice is with you, sir. Your chief guest address.
Thank you, Dr. Imran, Dr. Vijaypal, Dr. Richa, and all the global dignitaries on this virtual platform. First of all, I would like to congratulate on behalf of the Indian Academy of Forensic Medicine Governing Council 2022-25 a very big, happy National Forensic Medicine Day, which is the 3rd day in India, and a brief about how we started this day in India. Most of you may be aware that, especially global community, that Indian Academy of Forensic Medicine, way back in 1972, on 12th May, was established, founded in state of Goa at that time, under the Society Registration Act. And since then, in 2022, we completed our golden jubilee year and organized one national conference in the Lucknow Sanjay Gandhi Postgraduate Institute of Medical Sciences. And at that time, we decided to declare every year to commemorate Foundation Day of IFM as the National Forensic Medicine Day throughout the country, so that new generation, at least motivated, come to know about the role of forensic medicine, especially in protecting the community of the medical fraternity, because now medical negligence cases are increasing day by day in India, because India is going to become a big medical hub. Criminal negligence cases similarly are increasing, now reported by the National Crime Record Bureau since 2017. And it was felt that and Government of India now started with the one district, one medical college. That means every district now in future have one medical college. When there is a medical college, there is a Department of Forensic Medicine, where forensic medicine work is to be done and forensic medicine faculty will join. So growth is huge. Along with forensic science, there is a National Forensic Science University established in Ahmedabad, and many UP started UP Forensic Science Institute, autonomous body under the government of UP, affiliated to National Forensic Science University. Similarly, we started in 2022 forensic nursing course for MSc, and forensic dentistry already started. So there is a lot of work started in India, and advanced institution like AIMS, we started virtual autopsy. So with these little bit development, which I want to share with team GLFMs and global community, and I invite and request Dr. Imran to coordinate with all the global faculty, so that periodically we will organize such type of CME conferences, seminar, so that we can mutually add value to our knowledge in the field of forensic medicine and forensic investigation, death investigation, especially in cases of sexual assault. And almost every day there is a news in the media and cases approaching either High Court or the Supreme Court, because lack of knowledge and lack of literacy among the rural population, these cases where child, because this POXA Act come into picture in 2012, where child less than 18 years, both gender neutral, whenever they are sexually exploited, a case has to be registered mandatorily to the police. And there are many issues related to right to privacy, right to autonomy, right to reproductive right. And these cases are clarified by the Honorable Supreme Court and various High Court under their constitutional jurisdiction under Article 21 of the Indian Constitution. These are the fundamental rights even of minor. Her consent is needed. If she is not willing for MTP, we cannot force, even if she is not married. And Justice Juvenile Board and Justice Juvenile Act is there. Yesterday, there was a case from Bombay, which reached to the High Court, where we are teaching this incestual relationship, where brother and sister both are minor, 14 years and 12 years. They indulge in sexual intercourse. Ultimately, she became pregnant. When she suffered, and she was not knowing she is pregnant. When she suffered some pain in the abdomen, she complained to mother. Mother went to the hospital, and hospital, after taking history, suspected of pregnancy, and after investigation, it was found pregnancy which is advanced to 25 weeks of gestation. Medical termination of pregnancy does not permit beyond 24 after 2021 amendment. Previously, it was only 20 weeks, especially in those cases where a substantial anomaly in the fetus is allowed. So ultimately, Supreme Court has given notice for Constitutional Board, take their opinion, and case is posted for the Monday. That means 13th May. So these are the various medico-legal cases coming up in the clinical practice also, where all the person may be radiologist who is doing ultrasound, gynecologist or pediatrician treating the patient because it is a child. So they are facing the problem. And there is a conflict. Suppose in a family scenario like this, father is saying something, mother is saying something, family members are saying, because honor of family is involved. So not easy to handle this situation. Child Welfare Committee is already there due to under the Child Welfare there's a Act, and Child and Welfare Women Ministry is there. They are coming forward. State legal service authorities, district legal service authorities, national legal service, a lot of network is there to support the family, even though there are problems and these patients are suffering not only physical, the mental health. Many patients trying to commit suicide. So a huge problem with the medical fraternity, where forensic medicine can play a great leadership role in guiding all the clinical fraternity and along with the death investigation. So with these words, I again congratulate all of you to join hand with the National Forensic Medicine Day celebrated throughout India and all the department. Almost I have received the information yesterday. Dr. Richa itself in her medical college organized a quiz for the interstate medical colleges, and many students participated and they got different prizes by answering those questions, although very difficult question by MBBS first year, second year student. So with these words, I thanks Dr. Imran, Dr. Bijay Pal, Dr. Richa, and all the global fraternity who has joined this platform. Now over to Dr. Imran for further. Thank you. Thank you very much.
Thank you, sir. This-
Thank you, President sir, for your nice words. Thank you.
Thank you.
so as per-
sir, for listening.
Thank you. Thank you.
Thank you, sir, for your wisdom, for words of wisdom. I'm sure all of us will benefit from them now.
Yes, as per advice from our president, Dr. Vijay Pal sir, that after the chief guest address, nobody will talk. So just sharing the certificates. So Dr. Vijay sir.
Good afternoon. So with great pleasure, the certificate of accomplishment is being delivered to Dr. Mukesh Yadav sir, the President of Indian Academy of Forensic Medicine, and this is the day which has been on account of his efforts. In the national conference, he suggested that we must celebrate Forensic Medicine Day on every 12th May. And this is the third time that the Forensic Medicine Day is being celebrated all over the country. So please accept the certificate from GLAFIMS India for your presidential address, and in this international e-conference on the theme Neoteric Forensics, organized jointly by GLAFIMS India and Colegio Federal de Peritos, Mexico. So please accept the certificate, sir.
Thank you. Thank you, sir.
Then I request the guest of honor, Dr. Kamoda Prasad Saha from GLAFIMS Bangladesh, for facilitating as guest of honor in international e-conference on the theme Neoteric Forensics, which is organized jointly by GLAFIMS India and Colegio Federal de Peritos, Mexico. Dr. Saha, please, sir.
Thank you. Thank you
Thank
very
you,
much.
Then the certificate of accomplishment is being handed over to special guest, Dr. Victor, for facilitating as special guest in international e-conference on the theme Neoteric Forensics, organized jointly by GLAFIMS India and Colegio Federal de Peritos, Mexico.
Dr. Carlos, you can take the certificate on behalf of Dr. Victor.
Okay, perfect. Thank you very much.
Thank you, Dr. Carlos. Thank you.
Thank you very much.
Then this certificate of accomplishment is being delivered to special guest, Dr. Carlos, for facilitating as special guest in international e-conference on theme Neoteric Forensics, organized jointly by GLAFIMS India and Colegio Federal de Peritos, Mexico.
Thank you very much. I appreciate you. So, thank you.
Thank you, sir. Thank you.
Okay, so here I will take over. So this certificate of accomplishment is given to Dr. Vijay Pal Khanagwal sir for facilitating as the chairman on day 2 of Forensic Medicine Day event in the International Conference on theme Neoteric Forensic, organized jointly by GLAFIMS India and Colegio Federal de Peritos. Please accept, sir.
Thank you, sir. Thank you.
Yes, sir.
And the certificate of accomplishment is being delivered to Professor Dilip Kumar Goswami for facilitating as co-chairperson on day 2 Forensic Medicine Day event in International E-Conference on theme Neoteric Forensics organized jointly by GLAPSIMS India and Colegio Federal de Peritos, Mexico. Professor Dilip Goswami, sir.
Dr. Richa can accept this on behalf of.
Okay, Dr. Richa, please accept the certificate on behalf of Professor Dilip Goswami.
Thank you, sir. Thank you, sir.
Thank
On
you.
behalf of Professor Deep Goswami, I kindly accept the certificate.
Thank you. Then the certificate of accomplishment is being handed over to Dr. Imran Sabri, our patron, for facilitating as co-moderator as well as the key person for all the events on day 1 as well as day 2. Forensic Medicine Day event in International Conference on theme Neoteric Forensics, organized jointly by GLAPSIMS India and Colegio Federal de Peritos, Mexico. So
Yes,
3
sir.
cheers for you, sir.
Yes, sir. Actually, it is great pleasure for any student that he is receiving a certificate from his teachers. So it is
Thank
our
you very
great
much.
respect that our
I
teachers
feel honored,
think
sir.
that we have been awarded.
Thank you very much. Thank
Great.
you. Thank you for the honor. Then the certificate of accomplishment is being handed over to Dr. Perumal for facilitating as co-moderator on day 2 Forensic Medicine Day event in International E-Conference on theme Neoteric Forensics, organized jointly by GLAPSIMS India and Colegio Federal de Peritos, Mexico. So Dr. Perumal, very active professor. Please accept the
Sir.
certificate, sir.
Sir, thank you so much, sir, for this wonderful university. I'm the student only, sir. Student of respected all of your professors, sir. So I'm learning a lot
We
of
all
things
are a
from the
student,
classes,
Dr.
sir.
Perumal. We all are a student for these senior
Yes,
teachers.
we all are the students of forensic medicine.
Yes.
Yes,
So
sir.
please
Yes, sir.
accept the certificate, sir, Dr. Perumal.
Sure, sir. Sure, sir. Thank you, sir, for this wonderful
Thank you.
opportunity, sir, for the entire Platforms Association. Thank you so much, sir.
Thank you, sir. Then the certificate of accomplishment is being delivered to co-organizing secretary for the day 2, that is GLAPSIMS, the Forensic International E-Conference, which is jointly organized by GLAPSIMS India and Colegio Federal de Peritos, Mexico, on the theme Neoteric Forensics. Dr. Chaitanya Mittal, please accept the certificate from GLAPSIMS India and from GLAPSIMS Mexico.
Thank you, sir. Thank you very much. Thank you, Imran sir. Thank you, Richa ma'am. Thank you, Vijay.
Thank you.
Thank you.
Thank you. And congratulations for we'll be joining Patna AIMS, I think, very soon.
Thank you. Thank you very much.
Then
In July, madam, probably I will join.
right, thank you. So this certificate of accomplishment is being handed over to Professor Dr. Richa Gupta, the organizing secretary, for facilitating as organizer of International E-Conference on the theme Neoteric Forensics, which is they organized jointly by GLAPSIMS India and Colegio Federal de Peritos, Mexico. Dr. Richa, very active professor and always involved in organizing the e-conference as well as the webinars and seminars which are being organized by GLAPSIMS India. So hearty congratulations and best wishes, Dr. Richa.
Thank you, sir. Thanks a lot, sir, for your
Actually,
praise.
I need to give a word to Dr. Richa. Just when he joined Agra, then the status of Agra is increased a lot under her leadership. Before
Right.
that, people think that Uttar Pradesh is not doing great in the forensic medicine. But with the recent advances, with the recent new leadership under Dr. Afzal, Dr. Richa, Dr. Kaleem, Dr. Mukesh sir, and Dr. Abhas sir, with this kind of new leadership, the Uttar Pradesh has
Yes,
become
certainly.
leading in forensic medicine. So this is good efforts from our side.
Absolutely.
Yes, and Agra is one of the pillar. Agra is one of the pillar for forensic medicine in Uttar Pradesh, and under the leadership of Dr. Richa Gupta. Yes.
Absolutely.
Sir, I agree to you, sir, and it's totally fine. And so I agree that the present young leadership in many medical colleges are working hard. And a few names, worthy names, I would add along with me. You have added one, and one more I would add along with it. That is Dr. Shirley from KGMU. She's also working very hard. Dr. Archana ma'am from Allahabad, Prayagraj. She's also very devotedly, and I hope that we will one day mark a point in the all over India that presently we are the most retired UP and Bihar, at least in the forensic medicine, I will admit. But yes, now they have recognized that we are working hard and our efforts are being recognized. Thank you, sir. Thank you.
Absolutely.
Thank you. With this, we came to an end for this certificate presentation ceremony. And I think, Dr. Vijay sir, if you allow, so we can finish this session and go to our next session because our presenters will be waiting.
Yes, we can start with the next presentation.
Yes, so thank you. With this permission from the chair, the session 4th is ended. Now we will start with our next session, that is last session of this conference. That is session number 5, which includes a presentation session, invited guest talks from the key speakers. So I can see the first is Professor Dr. Kamoda Prasad Saha, sir. Yes, sir. Dr. Kamoda Prasad, sir. Are you ready?
Yes. Yeah, I am ready. I am trying to screen share. If I can't, then you share it from your side. I'm
Yes.
trying.
Yeah, we will do it from here. No, don't worry, sir.
Yeah. I'm trying.
Yes. Can you make it as a slideshow, sir?
Yeah. Just let me see. Slideshow.
Yes. Yes.
I think it's okay.
Yes.
Okay, thank you.
Yes.
Good evening and welcome you all again. My today's topic is current status of forensic medicine education in Bangladesh. Before going to my presentation, I seek apology because my presentation has 60 slides, which is not possible to discuss in 30 minutes that is allocated for me. So I will skip some slides, but they will remain there in my PowerPoint presentation so that if someone is interested, he or she can go through later. First thing, introduction. Forensic medicine is a specialized subject where medical knowledge is used for the legal purpose. In modern era, it has improved significantly and gained top attention to the academics, judiciary, and legal agencies. Though in developing countries, it has not gained its space alike to developed countries due to many obstacles. In Bangladesh, from its birth to 54 years onward, the field has changed and improved in academic field. Undergraduate and postgraduate education in forensic medicine is being revised according to the need of the country. Background of the forensic medicine in Bangladesh. Bangladesh bears the legacy of British era and Pakistani era in all aspects, like legal aspect, social aspect, and educational aspect, as well as the forensic education aspect. During the British period, the civil surgeon, who would be a British doctor, was responsible for all medical legal works. Bangladesh got its independence in 1971 and started its space journey as a sovereign country. Bangladesh Medical and Dental Council, shortly known as BMDC, was formed in 1972 by an ordinance and later passed in the parliament in 1973. Former medical jurisprudence department was replaced by the name forensic medicine department. In developed countries, medical legal issues are solved by divided service, by medical examiner system or hybrid model of police, medical examiner system and coroner system. In Bangladesh, it is integrated service system led by police like other developing countries. Forensic medicine in educational level, some other countries it is also termed as legal medicine, state medicine, and in Bangladesh, at undergraduate level, this name of the subject is forensic medicine and toxicology. The forensic science is a huge area and there is huge scope to service and study. But in Bangladesh, the study and service of forensic science is very poor. Role and objectives of modern education and teaching learning are to improve and attain knowledge, skill, attitude, and some competencies. And modern teaching methodology, technology, and tools are integrated teaching, problem-based teaching and learning, evidence-based teaching and learning, practical and student-oriented teaching, simulation in education, application of artificial intelligence, and competency-based curriculum. Among these, most of the points are not available in Bangladesh. Regarding integrated teaching, we have just altered our undergraduate curriculum in 2021, and integrated teaching is trying to introduce the curriculum. Problem-based teaching learning and evidence-based teaching learning is not in practice, particularly in forensic medicine in Bangladesh. Practical and student-oriented teaching are trying to implement. Simulation in education is also absent, and also help of taking artificial intelligence in education is absent in Bangladesh. As I mentioned, our last undergraduate curriculum in 2021, we have tried to develop it as a competency-based curriculum. Forensic medicine education level in Bangladesh, if we follow, undergraduate level it is MBBS, postgraduate level diploma in forensic medicine, MCPS, member of College of Physicians and Surgeons, FCPS, fellow of College of Physicians and Surgeons, and MD, Doctor of Medicine. Different types of training, particularly in in-service training by the government organization, and some seminar, symposium, and workshops are there. This is the chronology of forensic medicine education. In 1974, forensic medicine was introduced as one of the 9 essential disciplines in MBBS course, though at present, in MBBS course, there are 11 examining subjects. 1982 MCPS course was introduced by BCPSS Bangladesh, and 1997 diploma in forensic medicine, that is diploma course, was introduced, and now total seat is 40 plus in Bangladesh. In 2005, MD course was introduced in Kiranga Medical College under Kiranga University, but no student was admitted there, and no specialist come out. In 2022, Bangabandhu Sheikh Mujib Medical University, which is the Center of Excellence of Bangladesh, introduced MD course, and there are 12 seats there. And in 2022, FCPS course is also introduced by BCPS, Bangladesh College of Physicians and Surgeons, which is most important professional college in Bangladesh. In Bangladesh, there is a professional organization working with forensic education and forensic service. That is the Medico-Legal Society of Bangladesh. They arrange some seminar, symposium, and educational programs for Bangladeshi forensic specialists. There are some social media groups working on forensic education in Bangladesh, though it is very few. I skip. Forensic medicine education related authorities in Bangladesh, if you see, there are medical colleges, 17 government medical colleges and 72 non-government medical colleges, and 6 army medical colleges. They provide teaching and examination both for undergraduate and postgraduate medical education. In 8 government medical colleges, there is a diploma in forensic medicine courses. 4 medical universities, they provide academic administration and certification of undergraduate medical studies. And the Bangabandhu Sheikh Mujib Medical University, that is BSMU, their function is curriculum development, teaching, examination, and certification at postgraduate level. BCPS, they also work on curriculum development, teaching, examination, and certification, also postgraduate level, that is MCPS and FCPS. And there is BMDC, which is regulatory body for medical education and service in Bangladesh. They approve the curriculum and standardize the medical education curriculum, both undergraduate level and postgraduate level. And Director General of Medical Education, they also involved in curriculum development, both only undergraduate level. Curriculum of forensic medicine education in Bangladesh mainly covers the topics like forensic pathology, forensic toxicology, forensic psychiatry, medical ethics, legal procedure, identification, forensic aspects of sex and reproduction, and forensic odontology. This is the undergraduate level forensic medicine education in Bangladesh. MBBS course is divided into 4 phases, 11 examining subjects. Forensic medicine along with pharmacology are at phase 2, and duration of teaching is 1 year. Total mark 60 and pass mark is total mark 300 and pass mark is 60% overall. This is the picture of undergraduate medical education curriculum, which is just we amended in 2021. In this MBBS undergraduate curriculum, as an objective, departmental objective of forensic medicine at undergraduate level, that is MBBS level, here is 10 point has been mentioned. I don't want to go in detail as because there are many slides. There is also a list of competencies to acquire at MBBS level. This is mentioned in the latest curriculum. As I mentioned, we are trying to implement the competency-based curriculum. Here are a list of 14 competencies. I am not going to detail of this also. This is course and evaluation procedure of MBBS. in relation to forensic medicine. As I mentioned, at MBBS level, forensic medicine toxicology department, duration 1 year, total allocated time 185 hours, fragmented. There are 2 terms, 6 months of each term. In course assessment, term assignment and term final examination are there. Term final examinations are 300 marks and practical 100 marks. There is formative assessment, 10 marks, 6 marks for term examination, 2 marks for attendance, and 2 marks for item examination. And there is a summative examination after 1 year, that is second professional examination under the university. This is the distribution of marks in second professional examination: written 100, oral and structure 100, practical examination 100, total 300, and pass mark is 60%. Postgraduate forensic medicine education, DFM, duration 2 years, and eligibility criteria for entry is MBBS or equivalent degree, mainly 2 years after passing MBBS or equivalent degree. This is the curriculum of postgraduate medical education, that is DFM curriculum. I skip this. Here is exam procedure for DFM evaluation, course evaluation: 300 written marks, clinical and practical 200 marks, and oral 100 marks, total 600 marks. And pass mark is 60% in all segments. Now, next is MCPS, Member of College of Physicians and Surgeons, MCPS course. It is a course designed and supervised by Bangladesh College of Physicians and Surgeons, that is BCPS. Enrollment criteria is 2 years training of forensic medicine in its accredited institutions. Evaluation procedure is after 2 years of successful training, it is accredited institution. Final examination is held. Here total marks is 400, written 100, paper 1, paper 2 100, clinical and practical 100, oral 100, and pass mark is 60% again. Fellowship program, Fellow of College of Physicians and Surgeons. It is also designed and supervised by College of Physicians, Bangladesh College of Physicians and Surgeons. 3 years duration. It has 2 parts, part 1 and part 2 in course. Course enrollment with MBBS or equivalent degree recognized by Bangladesh Medical and Dental Council. Part 1 examination held in every January and July session this year. MCQ based 4 hours comprehensive examination. Total marks 300, pass mark is 180. Passing MCPS part 1 examination is the entry of part 2 course. And in part 2 course, there is 3 years training program. And completion of the non-credit course, research methodology, educational method, forensic science, computer forensics, DPR, behavioral science, soft skill, newer issues in forensic medicines. Here for part 2 course evaluation, marks is 300. Paper 1, written paper 1 100, written paper 2 100, and oral practical examination 100, total 300, and pass mark is again 60%. Then the MD course, Doctor of Medicine, designed and done by and evaluated by BSMU, Bangabandhu Sheikh Mujib Medical University, 3 years duration course, phase 1 or phase A 2 years, phase B 1 year. Course enrollment, MBBS or equivalent degree, 1 year in internship completion, 1 year after internship completion, that is 2 years after passing. Admission test is there for enrollment. After admission test is happened once in a year, usually at November, and course start at March. Here also written 300 marks, oral 300 and practical 300. In written there are 3 papers. Pass mark is 60% again. Part 2, written examination 300. There are 3 papers. Practical here is 500 and oral 100. Total 700, and again pass mark is 60%. And in phase B of MD course, there is research work, submitting the thesis, embodying the result of the research, and thesis defense. After second phase, BSSMU certified the experts. We go through the forensic course in South Asia region. In India, there is short certificate courses, BSc in Forensic Science, Diploma in Forensic Science, 1 year, postgraduate diploma, MD, MSc in Forensic Sciences at PhD. In Pakistan, postgraduate diploma, certificate courses, MPhil, Masters and PhD in Nepal, MD in Forensic Medicine. There is, we don't find data from Bhutan and Maldives. And in Sri Lanka, diploma in Forensic Medicine for lawyer and judges, MD, diploma in legal medicine for DLM for medical graduates. Overall forensic education worldwide, actually there is diversity in program. Many countries offer undergraduate and postgraduate program in forensic medicines, forensic science and related discipline. And the programs may vary in duration, curriculum and specialization of the area. There is interdisciplinary approach. There is a growing trend towards interdisciplinary education with programs integrated elements of medicine, law, science, and technology to provide comprehensive training in forensic investigations. Online education is the modern trend. With advancements in technology, online courses, and distant learning program in forensic medicine and forensic science have become more prevalent, allowing students to access education from anywhere in the world. And emphasis on practical skill. It is very important. International programs often emphasize practical skills such as autopsy techniques, evidence collection, courtroom testimony, crimes investigation, etc., which needs exposure to real cases and hands-on experience. In Bangladesh, there is some changes in academic field recently. Still, the changes are going on in undergraduate and postgraduate courses, curriculum, number of seats, examination and evaluation procedure. Undergraduate and post-graduation forensic medicine education is being revised and upgraded from time to time. Implementation of competency-based curriculum and assessment method to ensure graduate possesses necessary skill and knowledge. Participation in international conference and workshop to stay updated on global advancement in forensic medicine. These are the recent changes. I skip this. Attitude towards forensic medicine education in Bangladesh. Forensic medicine is always underappreciated in Bangladesh and also having some socio-psychological stigma. There is negative attitude towards forensic medicine education in Bangladesh. Actually, student and doctors are not interested in forensic medicine as a career or course. It is bitter truth that the majority of the medical students and doctors are not interested to build their career in this field. They want to build up their career in technical and patient-oriented field as for the purpose of monetary solvency. There is no remuneration for the forensic specialist or doctor for doing medical legal service in Bangladesh, but the attitude is changing slowly. I want to skip. Trying 15 minutes, okay. Challenges in forensic medicine in Bangladesh. Actually, several challenges hinders the effective delivery of forensic medicine education in Bangladesh, which includes lack of specialized training program. There is very limited specialized training programs in forensic medicine, leading to shortage of qualified faculty. Extreme shortage of forensic manpower. Shortage of qualified teacher and expert is a great problem in Bangladesh. Inadequate infrastructure. Many medical colleges lack proper forensic laboratories, equipments, and modern work, hindering practical learning. Curriculum and teaching methodology is not updated. It needs update to incorporate modern forensic techniques and technology. Limited research opportunities. Forensic medicine is underdeveloped, limiting opportunities for students and professionals to engage in research activities. Inadequate research supply. Budgetary allocation is very low towards forensic medicine education and also service. Expansion of postgraduate training opportunities and certification program for forensic medicine, and integration of forensic medicine into medical and legal curricula to promote interdisciplinary collaboration, and development of online courses resource to reach the wider audience and bridge gaps in access to education, and advocacy for policy changes to improve forensic investigation and legal procedures in Bangladesh at the future outlook. There is some good sign that forensic medicine is flourishing in Bangladesh in near future, I think, and it will be considered as lucrative subject. More female doctors will come forward to make their career in this field. Strategic interventions. Here we need investment in forensic laboratories. Government and private sector investment is needed to establish well-equipped forensic laboratories in medical colleges. Technology integration, incorporating modern technologies such as DNA analysis, digital forensics, AI technology into forensic laboratory facilities are important. Curriculum enhancement includes curriculum review committees, establishment of committees comprising forensic experts to review and update the curriculum regularly. Integration of practical training. Introduce practical training session using simulation model and real life case studies. Interdisciplinary approaches includes interdisciplinary topics like forensic psychology and forensic nursing in the curriculum. Then forensic faculty development, specialized training program, implementation of training program and faculty members to enhance their skill in forensic medicine training and research. Collaboration with international institutions facilitates partnership with international universities for faculty exchange program and training workshops. Incentivizing forensic medicine specialists. Offer incentives for medical professionals pursuing specialization in forensic medicine. Research promotion. Research grant provide funding opportunities for researchers in forensic medicine. Encourage student involvement. Promote research activities among medical students, though research fellowship and student-led projects. And international collaboration and online education also important. Quality assurance of education by training, certification, and educational audit. We should focus on this point, development of guideline, protocol, and SOP. Best practice at international level. Monitoring and supervision by creating specific bodies. Accreditation is important to create accreditation bodies in Bangladesh. Standardization of curriculum is very important. International collaboration, education audit, and continuing education. These are the quality assurance of education in forensic medicine. Recommendations to improve the forensic medicine education in Bangladesh. To establish the specialized institution and university for forensic medicine. Introduction of newer course in subspecialties of forensic medicine, which is too much lack in Bangladesh. Evaluation system. This is very important. In our country, as I shown in the evaluation process of different undergraduate and postgraduate level, always pass mark is 60. There is no grading system, only pass and fail. So, and it is a conventional method, but internationally now the evaluation method is focusing on semester system, credit system, and grading system, and we should go on this line. Incentive and remuneration for forensic service or forensic people. Motivational program. Actually, as I mentioned previously, that there is a social stigma regarding forensic medicine. We should have some motivational program in through the print and electronic media and different types of social program. Career plan. This is one of the important thing, as because in Bangladesh there is very scarcity of medical teacher in forensic medicine, but on the other hand, there are some postgraduate degree holders who are not getting the position for teaching. Assurance and security, assurance of safety and security. It is a very important issue in forensic medicine in Bangladesh. The forensic people are to face the court, and as every report goes in favor of one party, the aggrieved party always is a threat for the forensic people. Assurance of proper honor and dignity. In Bangladesh, sometimes the people's call the forensic doctors as the doctor of the dead body. Elimination of social stigma, as I mentioned. Adoption of professional codes and standard with establishment of separate regulatory body for forensic education and service. Implementation of medical, legal, and forensic service at private level. Actually, in Bangladesh, medical, legal, and forensic service is provided only in government sector. Only educational service, that is forensic medicine education, is given in the private medical colleges, but private medical colleges don't give any medical, legal, or forensic service. So those who are working in the forensic medicine department or only in the government medical colleges, they can give some forensic service to the country. So medical skill service should be extended in the private level also. Policy recommendations. Forensic medicine and its education should be addressed in health and education policy of Bangladesh. In Bangladesh and in Bangladeshi health policy and education policy, forensic medicine is forensic medicine education and service is actually absent. It requires government support, regulatory reforms, investment in infrastructure and human resource, and last one, collaboration among policymakers, academia, and civil society is most important. In conclusion, in Bangladesh, education in forensic medicine is developing day by day, but development and expansion rate is not getting expected speed. We have to face various problems. An interesting and important observation is female doctors are showing interest and coming forward more as teacher of forensic medicine department in Bangladesh. Both qualitative and quantitative improvement of forensic education and its implementation should be prioritized in Bangladesh. Thank you all. I think I have finished within the time.
Yes, sir. Thanks a lot for your detailed information about forensic medicine at Bangladesh and all over the world. Anybody has any questions? Any panelists, any attendees want to ask anything? Or we should go ahead? Okay, fine. Thanks a lot, sir.
Dr. Saha, I have a question. Dr. Saha,
Yeah,
how
yeah.
much of postgraduate education is funded in Bangladesh by, or what is the system for funding? Are they working as medical officers, or are they got a stipend, or are they regular duty medical officers? What is the system there?
Yeah. There is scope for postgraduate education both for the government service holder and non-government private candidates. For the government candidates, they don't have to pay, rather they get their salary from the government side. But for the non-government or private candidates who got admission in the postgraduate courses, at present, previously, just few years back, there was no remuneration or stipend, but at present, they got some amount of stipend, that is 25,000 taka per month.
I see, because many years back, when we were undergraduates and all that, we had gone on strike to make sure that the postgraduate stipend was converted to general duty medical officer's salary. So that the argument was that residents are running the hospitals, therefore they should be treated as, medical officers. And that's been the system. So automatically, when the GDMO's salaries increase, the resident postgraduate trainee salary goes up. I mean, so you people haven't come up with a system like that, right? It's still stipend, right?
Yeah. Just they get some stipend. If he or she is an private candidate, got admitted into the course, they get 20,000 taka per month as stipend. And after that, after completion, if he get the job, he will continue the job and he will get the salary. On the other hand, if he or she is an government candidate, he will continue his job after getting the degree, and during course he will get the salary as a medical officer.
Thank you.
Thank you, sir. With this, I think we will thank you, sir, Dr. Kamoda, sir, for your wonderful session, wonderful speech. We can, I can go to the next our speaker, which is Dr. Rakesh Goria, sir. Sir, you are over here.
Yes, I am there.
Okay, sir. A short introduction about Rakesh Goria, sir.
Yes, actually, Dr. Rakesh Goria doesn't need any introduction because of his history as a forensics.
Sir, I think.
But let me do it. Please give me.
Yeah, sure, sir.
Yes. Professor Rakesh Goria, sir, is one of the living legend of forensic medicine. We and our seniors have learned a lot of things from Professor Rakesh Goria, sir. And still we are learning many things from our respected teachers, respected seniors. It is the pleasure of our whole BFMs and our respected sir, Dr. Rakesh Gupta has accepted to deliver a lecture to facilitate us, our team, on global advancement in recent trends in forensic medicine. So Professor Rakesh Goria sir is presently serving as the head in the Gyan Sagar Institute. He excels expertise and talents and knowledge for the betterment of the society. He has a vast experience in teaching and supervision of medical legal work globally, rather. I can use the word globally. He served in many countries. He contributes his skill approach to helping and guiding numerous PhD scholars and research scholars. He has very associated with many societies, including Indo-Pacific Academy of Forensic Odontology, Indian Red Cross Society, Indian Society of Congress, Indian Science Congress Association, Forensic Science Society of India. The membership, there are lots of membership. Some of the memberships are Arab Society for Forensic Science and Forensic Medicine, and the World Association of Medical Editors. He is awarded and honored with numerous achievements like Lifetime Achievement Award by the Punjab Academy of Forensic Medicine Toxicology, the International Journal of Health Research and Medical Legal Practices, and Indian Academy of Forensic Medicine, respectively. He also honored with IAFN Vision Award 2007 by International Association of Forensic Nurses at Salt Lake City, USA in 2007. He served as a guest faculty at the University of Colorado, USA, and Punjab University, Patiala. He is also served as president of Indian Pacific Association of Forensic Nursing Science and has actively contributed to conducting numerous conferences and workshops. Being versatile personality, he is expertise in postmortem and medical legal examination and reporting. So this is a brief introduction. Basically, I don't have words to introduce, but these are some of the words which we gathered. So welcome, sir. Please, Dr. Richa, please ask sir to start.
Sir, we welcome you, sir. So please
Okay.
share your slide.
Are you able to see my screen?
Yes, sir. You
Are you able to
audible. Screen is also visible, sir.
Okay. Thank you. First of all, I will like to convey my gratitude to the organization that they have invited me, and I wish to convey my thanks to, especially to Dr. Richa Gupta and Professor Imran Sabri, and all my friends who are there, and all the delegates who are present in the conference, and that I have the opportunity to share my views on the global advancement and recent trends in forensic medicine. So I will be discussing about global advancements in forensic medicine and toxicology, as well as how to develop the subspecialties and which are the subspecialties in forensic medicine and toxicology which needs to be developed, and what are the recent trends in forensic medicine and toxicology. Simultaneously, I would like to say that when we are advancing, we must take care of the fundamentals. That is very, very important, on which the forensic medicine teaching, forensic medicine practice, that all depends. So first, I will like to talk about the global advancement in forensic medicine. So we should see that there are advancements taking place all around the world, but we are racing against the time that we should develop in our own countries, wherever we are. There we should go forward. Otherwise, sometimes when they come to our country, their time period is very less, and you see their utility becomes less as the new other advancements come, and our instruments, our all the progress becomes obsolete at that time. So we must act quickly in all these things. So briefly, I would like to say now it is a time for the artificial intelligence. It is time for the nanotechnology, and it is time for the DNA technology. So these are the most three important things which are happening in the field of the forensic sciences, as well as in the case of forensic medicine. But artificial intelligence, and simultaneously along with that, the virtual reality and the augmented reality, they are playing a big part. And as far as the mortuaries are concerned, we need to improve, because we should know what are the mortuaries of the future. And there is 3D printing has come in a big way, and we must use this 3D printing, and we must develop the subspecialties of the forensic medicine if we have to go ahead in our field. So, the artificial intelligence is all depends upon the machines, how they are going to learn, but what we are going to make them learn, that all depends upon us, because there is now three-dimensional conventional neural network, and this can do a lot of things, and it can perform generative and descriptive tasks, and can be very helpful for the forensic anthropological task. Usually, artificial intelligence, so far, it is being applied in the identification, whether it is age, sex, or sphelometric landmarks and landmarks. So, or sometimes it is also implied in the facial reconstruction when it is measuring the soft tissue thickness in the various parts of the face and the skull, that when we are going to do the facial reconstruction, when we find a skull. And in this, the cone beam computed tomography that plays a big role. And you see, artificial intelligence, is it better than what we do routinely? Yes, in some ways it is better, because it never gets tired and there is never a subjective bias. It is always very, very objective. And it has got its application in the sphelometric parameters, angle, ratios, and distances. So that can play a big role in this. So in sudden death, it can also be useful in evaluating hard tissue as well as the apparent damage, which may be responsible for the death. So we can see from that. The technology of the virtual reality, that is the another technique. So this helps us to see a 3D three-dimensional view of the crime scenes and other things wherever this is applicable. So, but whenever we are using the virtual reality, we should know that it needs experience, and the cost can be a factor in this. And there are certain softwares which are present for this, with which we must be accustomed to before we are going to use this. So I just show you a few photographs of the crime scene investigation in the virtual reality. So just like these are the things which we require. And you see, this is one of, on the left side, this is a crime scene. So this is seen, sometimes you don't see anything, or you don't find anything, or you can miss something. But if you see, when we are going to enlarge it and see in the virtual reality, in one of the corners, you can see the small spots of the blood. So sometimes at the crime scene, these may be missed, but later on, if everything is seen in the virtual reality, sometimes maybe we find out things which we may miss with the naked eye sometimes. And then there is augmented reality. So this goes a long way in teaching that augmented reality that can be used, because it is going to increase the perception and interaction with the real world. So for this, different softwares, different kits are present, which can be used and which are being used all around the world. You see what suits you, you can take that kit. So augmented reality involves recognition, AR tracking, AR content rendering. And so even during the autopsy, it can record the injuries on the surface with the help of CT scan. And later on, we can see it in a very good way. And this available data, which will be there, which we will put into this in the machine learning, that will also help in the future postmortem examination and will make things simple and economical too, especially at those places where the experts are not available. So augmented reality in medical education, this is being used very commonly, especially in the advanced countries. Even in Saudi Arabia, I have seen that this is being used now in India. Also, some of the colleges, they are going to use it. And you see, it is simply wonderful. And once you have seen it, you see how useful this can be. And the students which sometimes they don't know what are the things which are there, so they will get adopted to it very quickly. And we can progress, because majority of our work by which we are known, that is the forensic pathology, and we are going to work in the mortuaries. So we must modernize the mortuaries as is being done. So in PGH Chandigarh here, so that is one of the best mortuaries in the world. I have seen, I have gone through so many countries, and what I see, that is comparable to any part of the world. And we should try to develop our mortuaries like this. But all those who are responsible, they must make concerted efforts, only then it is possible. So when we are talking about the mortuary, it is the autopsy room, it is the radiology simultaneously, and it is simultaneously the virtual autopsy. And one thing, robotic postmortem examination, and other things which are going to help us is the intraoral camera. Intraoral scanners are also there, and forensic photography can do wonders. And when all this is seen with the augmented reality, probably that is marvelous. So you can see what the mortuaries of should be look like of the future. It is not less than any operation theater. Even in the lights which are there are cameras in it, and all the things which are we are dissecting, which we are seeing with the naked eye, that is being picked up by the camera, that is being put on the screen. We can see that wherever we are doubt, because the magnification is possible in that case. And our students, they can also simultaneously, because they are standing at the distance and usually they don't see what we are seeing. So with this help of this, our students can be greatly benefited by this method, adopting of this method. Now, previously we were portable X-ray machines. Now these are the handheld portable X-ray machines are coming, and this is going to help a lot, especially in the forensic odontology field. This is going to be a very, very good instrument. And the virtual autopsy, you must have learned, some of you must have seen it also, that it is a very, very quick method. It can be within minutes, and it can be useful in those circumstances where we don't need sampling, at least mostly in the cases of accidents. This can be very commonly used, and there are falls, or there is a drowning. So usually in such cases, when there is a no foul play is suspected, so especially in those cases, this can be very, very helpful. But it doesn't mean that it is not good for the homicides and suicide. It can be helpful in those circumstances, but again, there are limitations to that. It is going to prevent the needle pricks, cuts, and exposure to the pathogens, to the all those who are performing the autopsy, and all the staff members of the mortuary. And virtual autopsy, so usually for this, the CT scan is required, and the various softwares that will be required are on the previously. Some 2D images and 3D images are present, and it can be compared with that also. And this can be done even remotely also. So virtual autopsy, but it has the disadvantage that the tissue samples can be taken, and if needed, routine autopsy is the only way. A virtual autopsy can complement the routine autopsy. I would like to show you a video if this works. I don't know whether it is going to work it or not. Are you seeing it? Anybody?
Yes, sir.
The video is
You
not
can-
playing.
You can see the various. It is working on my, but if it is not working, I can stop it.
This
If
video
it is,
is
you are not seeing it. You are not seeing it?
no, video is not working, sir.
So you need to share the video link, sir. Screen sharing you have to do.
Okay, I can move to the next slide. Oh, so it is still running. Just a minute. I will just stop it. So is it back? Is screen the back? Anybody?
Yes, it
Hello?
is.
Yes, sir. Yes, sir.
Okay. So you see, virtual autopsy can help in different circumstances, and if the cost is not the barrier, then it must be wherever we can do it, we should do it. So we are trying to develop it in the different parts of India. Some of the institutions, they are having it, and we are also going to have it in Punjab in the Medical Legal Institute shortly. And so robotic postmortem examination, if the robotic surgeries can be done, why we should not think about the robotic postmortem examination? And we can have, there are robotic assisted cadaver skull opening is present, and we can also do the CT guided robotic postmortem biopsy. Especially this becomes useful in those circumstances where coming near to the body, we get exposed to the pathogens. So then there is microbiome analysis. So microbiome analysis can help in identification. The personal microbiome is usually specific to an individual. So this can also be used to help in the identification. And in some places, it can help us the cause of death in drowning also in some cases. And this can also find on the location of the death because of the microbiome pattern in the different places, and then where we can see where we can advance is the biobanking, and biobanking in the human tissue can be stored for many years, including stem cells, and proper biobanking can give good results even after 10 years of sampling, and good for the genetic studies and good for the transdisciplinary studies. So we should see that whether we can, our forensic medicine subject can go into the biobanking, because we must expand if we have to get full respect from the society. But and my previous speaker, Dr. Sahu, was saying that sometimes that is lacking because we are not diversifying. That is the only reason we are sticking to what we were doing about 60 years back or 50 years back. So we should think about this, and it will sometimes there is need for a second opinion in the histopathology. So this can be a good source tissue can be there, and such tissue can be good for the research also. It can also help in the making the DNA data banking, but of course the quality control is required for all these things. So we can also need to diversify in the organ harvesting postmortem when we are doing the postmortem examination, and how the organ harvesting can be increased. So usually there is a will of donating organs in many persons, and if there is a will, we should respect it. And simultaneously, when this is being done, the quality of the dying can be taken care of by the nurses along with the patient and family discomfort. And we should think about it. And again, the definition of death, and that you see if it is good in your country, it is okay. If it needs revising, you can do it. And because many people need organs, and many people are dying because they cannot get the organs. So this is a very good thing. And but we must understand there are some socio-cultural challenges in organ donation. Usually in the Western country, you see those persons who say yes to the organ donation on their driving license, it is always mentioned that yeah, they wish to donate the organs, and then we must respect their decision. But in this, there comes the beliefs, superstitions, conflict of interest, altruistic values, and ethical dilemmas. We must overcome all these things. And sometimes there is a lack of support from the institution, or even sometimes the families, they are not cooperating. And there is sometimes need for, when the death occurs, quick transport and green corridors. So the forensic pathologist should have a positive attitude when organ donation or organ harvesting is concerned. Then in the disaster victim identification, of course, so many persons are needed, and we should work as a team. Intraoral cameras are coming, where in the forensic odontology, it can help a lot. Forensic photography, now the next speaker is going to speak on probably the crime scene investigation, and will speak about a lot of forensic photography. And this always helps, because our description can change, the person can interpret it in a different way, but the photographs which what they are going to tell, that is very good. So photography, augmented reality, virtual reality, say those are all things, they go hand in hand, and we must understand this, and this must we make beneficial to it. So in the toxicology part, what are the opportunities and future? And that is the poison gardens, visit in the open, having plants, visit to snake tube, nanotechnology in analytical poisoning, and advanced equipment for the lab. So we must take into consideration. So poison garden, we can take our students to the poison garden so they can see their, we can take them out and can show them and make their teaching interesting. And similarly, we can go to different places, botanical gardens, and all those places where plants are there. And simultaneously, we must teach the children that these plants are poisonous, they should not play with them. And there are different types of snakes. Mostly we try to kill the snake, but there are non-poisonous snakes which are beneficial to the farmers. We are again going to kill them. So visit to the snake use that can help in identifying that this is poisonous, non-poisonous, and we can make the community aware about this so that unnecessary snake killing is not there. Then nanotechnology is coming in a big way all around the world, and if the nanomaterials are coming, the nanotoxicity is going to be there, and we should be familiar about this nanotoxicity and the nanotoxicity material. And because they are being used in so many health products, these nanomaterials are being used, and even then there is going to be poisoning due to these nanomaterials, and for this various instruments needs to be there. So of course we can't have all these instruments at one place, because these can be the very costly scanning electron microscope, transmission electron microscope, atomic force microscopy, and there are so many types of the instruments which are required, but we must see that what we can get. Otherwise we can send the samples there, and then they can do this. The cytotoxicology with the nanomaterials, that is also occurring, and this we must understand that this is coming. We can't escape from this, and we must be sure that nanotoxicity, we can detect it, and because it can result in damage to the DNA through mutations, necrosis, and decreasing the viability of the cells, and this is the asbestos of the future. So various instruments, you can see, you can use it in this all this analytical toxicology, and so these are the things which are being used, and Fourier transform near infrared spectrophotometry is also being in nano poisoning. So this is the just a chemical lab I visited at Gandhinagar, Gujarat. This has a very good infrastructure as far as the toxicity is concerned. As far as concerning the subspecialties, there are various subspecialties which should be developed, and we are going to develop all these subspecialties in the Medical Legal Institute, which we are going to shortly open at the Baba Free University of Health Sciences. And there is clinical forensic medicine, forensic pathology, forensic psychiatry, forensic nursing, forensic odontology, forensic paleontology, forensic entomology, medical ethics, toxicology, and forensic photography. Probably this is not the exclusive list. You can do so many things. I think it will be better if we can have everything under one roof, under the clinical forensic medicine and forensic pathology, along with the different disciplines of forensic science which are there. So if this can be developed at one, so many bottlenecks are going to be removed. So clinical forensic medicine we are having in all our institutes, and we know about this. And similarly, forensic pathology is present at most of the places, but electrochemical biosensor, still we are not using it. And in the times to come, this is going to be a great role. And the mortuaries of the future, they will have the electrochemical biosensor, biomarkers, virtual autopsy, radiological facilities, robotic postmortem examination, modern facilities, and microbiome analysis. So we need to have all this at the mortuaries. So forensic psychiatry, of course, all of you know, not much work is being done on forensic psychiatry. Forensic psychology is developing at a good pace, but forensic psychiatry is not developing. So we must see that because it is required in many cases of crime, where the persons are feigning that they are not mentally well. And so there are recovery subscales, so we must know about this. And ultimately, forensic psychiatry, if we do it properly, it will help in the reduction of violence and reduction of deaths due to the mental disorders. So forensic nursing. So India has become the first country in the world to have the forensic nursing science at the undergraduate level, and post-graduation has also started in some of the institutes. So it has developed it is in the world, but India has taken a lead in the forensic nursing science and forensic odontology. So that can do a lot. Probably I can't talk everything about this, but you can see in the list that what are the different things which we can use in the forensic odontology. And forensic paleontology, pollen DNA, from that we can do so many things. And forensic entomology, of course, all of you know, but this is not developed at most of the places. Medical ethics, so we must not forget about the medical ethics, because only with following the medical ethics we can get respect in the society. And toxicology also that needs to be developed, and for that the human organs on chips. So now the research is being done on this. Forensic photography, 360-degree cameras are there which can record the crime scene in a very good manner. But for everything we need to do the research. And some newer concepts, if I have to talk about it briefly, that is dealing with the effect of witnessing the trauma, innocence project, digitalization in forensic medicine, preventive forensic medicine, humanitarian forensic, and developing subspecialties. So dealing with the trauma and death can produce psychological stress. So we are not taking care of all those persons, even the forensic pathologists who are dealing with all these things, that what effect it is having on their mind, especially the lower staff which is working on this. So we must take care that they don't get bad effect on their mental health. And sometimes we become so much go fast and at such a speed sometimes that we want to prove the guilt of the person, and ultimately we become biased. And then there is innocence network has taken that that is working other ways, that all those innocents who have been given a sentences by court, that should be reversed. And this has happened around the world, and this is happening in India too. And digitalization in the forensic medicine, there's a need, and for this the biosensors and all that which can help the postmortem blood glucose level, and when the death is due to diabetes or some of the chemicals, then that can be used in this. So we should see that when we are talking about the digital technology, this can be leaked. So we must talk about the blockchain technology, so that nothing gets leaked. So preventive forensic medicine, we are not at all working on the preventive forensic medicine. This research needs to be done so that we can at least reduce the number of the accidents. We can reduce the number of suicides in our society. And humanitarian forensics, we must know about that. Whenever there are mass disasters, the survivors has to be identified. Sometimes even the person unconscious who needs to be identified. Sometimes there are survivors, we should know that how we have to deal with them. We must take care of their psychological health. So complete caring of all those persons who need humanitarian approach, we must do that. So this is the department of the International Center of Humanitarian Forensics at Gandhinagar, Gujarat. But we must take care of the fundamentals. Everything, if can come under one roof, then that will be very good. We are going to do in Punjab one for rape cases. One-stop centers are being developed all over India, and we must see that what we can do good for the society, that we should do. And we should be ready for the mass disaster, because they can occur at any time, and we must strengthen the manpower and resources, because this is hampering in the work, and it will hamper it in the case of, especially in mass disasters. So whatever are the challenges, we understand this, we know this, we should make attempt to overcome all these things. We must take our students to various FSL labs and crime scene investigation so that they know more about it. And but whatever we do, this is totally useless unless we inculcate the moral values. We have to teach our students that they should follow the ethics, be honest, be empathetic. But those who what we are sitting, we are doing the practice. We must expose the black sheep amongst us, and you should be a role model for your student. And all this you can do only if you are a good human being. So you should be a good human being. I will like to conclude that know your strengths, weaknesses, opportunities, and threat. And with this SWOT analysis, you can understand the challenges and you can find a solution. We need to develop and strengthen our subspecialties. We need to dream big, and start working passionately on this dream to strengthen our discipline. As we have made this happen, forensic nursing, we have made it happen in India. So you should select the fields where we need development and work hard on it. It is the matter of time when these things will develop in India too. And this is because this is the only way. This is the only way to progress, provide efficient services to the society, and move forward. Thank you very much. If you have any questions, please let me know.
Thank you, sir, for your enlightening presentation. And I think from the root to the top, you have told all up to the recent advances, recent technologies, and many new technologies we have got exposed to, microbiome, nanotechnology. And further, anybody has any question, please raise up. Yes, sir, please. Joshua.
First, I want to share something, Dr. Goria. Here
Please,
in
please.
NUS in Singapore, and even in the Lee Kong Chen School of Medicine, NTU, the anatomy teaching and quite a bit of medicine and surgery is virtual. And when we take their forensic classes, we have a queued up list and we have to refuse number of students who want to do attachment with us for electives in forensic for 2 to 3 or 4 weeks. Why? Because you find some of them just handling a liver and a kidney. They have never seen it in real life. They have never examined a heart. You find a girl rubbing a hand over the kidney and say, kidney, that kind of stuff. So it's pretty pathetic. So if you think that virtual is a very good method, I'm sorry, because when we have these same people graduating and coming as MOs, their knowledge of anatomy, spatial anatomy, everything is terrible. And you can see that sometime in the notes, the ward notes relating to treatment therapeutic practices. So it might look very attractive. And for Singapore, the thing is that it is convenient because they don't have bodies for dissection. So they prosected plastinated specimens, a few of them, and the rest is virtual. And I can tell you that the quality of understanding the human body is very, very poor. So regarding the virtual, so this is my comment on the virtual learning and how wonderful it looks. Honestly, practically, we feel it's made medicine decline. The argument always is, if you have a problem, you can access the internet and study. I don't think that's a very good solution if the patient is sitting in front of you. So now relating to CTs, I think that CTs in the mortuary is a solution if you want to understand forensic radiology. CTs in the clinical department where you send selective cases for CT examination doesn't cut it. And your clinical radiologist is not used to doing the whole body from top to bottom. He's used only to doing, just regions. So when you show him the whole body right up to, say, the knees, you can't go beyond the knees up to the foot because the file size is very, very big at 0.5 mm slices. That he's very uncomfortable. I've had that experience with radiologists when we try to discuss cases with them. Now, virtual autopsy sounds great, but I think the first step for all of us is data analytics. And this I see not only the Singapore government, but the medical schools have started incorporating in their disciplines. So I think our Indian medical colleges should have a little basic in data analytics so that our students can incorporate it. And at a postgraduate level, it should be even better. So that leads towards a little bit of application of artificial intelligence. I made a comment in the chat that you talked about robotics assisting in doing targeted biopsies. But if, for instance, you don't know what is the cause of death, what is the likely infection, you have no clue what is the new emerging infection, where all is your robotics arm going to go and sample? It's easier, quicker, and neater to do a complete autopsy and biopsy everything. And as far as the building up the biobanks in the West, and I've seen them, including Armed Forces Institute of Pathology before it went defunct. They have tissues from the 18th century in places where the Americans have gone and managed treatment because it came from pathology. They did histopathology, they have the blocks, they have 150, 120 years old blocks to 50, 60, 70 years old. And that is your biobank for research. And now they've discovered some diseases of now were prevalent, say 30, 40, 50 years back. So for that, my comment is that in India, if we don't have a culture that every case we do histopathology, we are not going to have that biobank we talk about. It cannot be selective. Selective biobanks come from specimens collected by the pathology department. My comments on this. Any comments from your side?
Thank you, Dr. Jajpal, for your suggestions. Yes, you are right at many places. But I will like to add to what you have said, that of course there are limitations to everything, and we have to judiciously use it. And before using it, research plays a big role, and we need to have the data for everything when we are going to use it. So, but saying no to the future, probably that will also not serve the purpose. So what the things are coming, if we are not adopting, we will remain back in the previous century. So we have to move as other branches are moving. But we need to use it judiciously. Thank you, Dr. Jashpa.
Thank you.
Thank you, sir. Now, let me introduce our next presenter. He is Dr. Richa Gupta, currently serving as the head of the department and the organizing secretary of this conference. At present, she is head of the Department of Forensic Medicine, SN Medical College, Agra, with a experience of more than 20 years. Her educational journey includes MBBS from Government Medical College, Meerut, Maharashtra, followed by diploma in pathology and bacteriology from Government Medical College, Kolhapur, Maharashtra. Then MD in Forensic Medicine from IMS BHU, Varanasi, UP. And MBA in Hospital Administration from Sikkim Manipal University, and Diploma in Clinical Psychology from Indian Counseling Services in 2024. Dr. Gupta has been recognized with several accolades, including India Prime Woman Icon Award 2022 and memberships in esteemed medical associations. Her administrative roles extend to serving as Joint Secretary for Global Academy of Forensic and Investigative Medicine and Science, GLAFIMS, Associate Editor of International Journal of Medical Justice, reviewer in various reputed journals from various responsibilities at SN Medical College, Agra. She has actively organized and participated in numerous conferences, workshops, awareness program, demonstrating her commitment to academics and professional growth. Dr. Gupta's extensive publication record includes 25 national and international research publications, books, chapters, and even authored novel titled Beyond the Autopsy Room, The Gunshot. So, Dr. Gupta, dice is with you now. Please share your presentation.
Thank you, sir. Thank you, sir. Just I'm sharing my slide. Okay, sir. I am audible and my slide visible.
Yes, ma'am. Please go ahead.
So, I choose this topic, medical negligence, today for this conference, considering the rising cases of medical negligence in all over India, and since last 2 to 3 years, what I have been observing, there were lot of rising cases. There were a lot of cases coming to for not only for postmortem examination, also for the opinions, also for investigation, considering with the medical negligence. So I thought of putting this topic to this on this dice, and for today's topic would be about mitigating medical negligence. And I would like to include not only striving for excellence in patient care, but today I have also included in my slide about the legal compliance which any doctor should consider while starting his practice or his clinic or his hospital. What I have observed in these years, that whatever we study, that is all the academic side, MBBS study, MD study, the students of undergraduates or postgraduates, undergraduates, I would say, they are never exposed. They are all the academic. We learn about medicine, surgery, obs gynae, everything. But how to implement it when we come into the practice? Same thing goes with the MD students also. Whenever they come to the practice, they are totally entirely into a different world. What are the legal things which you should be knowing before starting your practice? Not only about the medical negligence side, but also about establishment side, also about the administrative side. I think that should also be included, and included this thing, included this topic. So starting from this, the basic what we understand and we already know by negligence is the 4 Ds of negligence. Now this is simply in a word that healthcare providers' failure to meet the standard of care expected in the profession, resulting into a harm to a patient. That is in a simple word which we say that is a medical negligence. 4D is duty of care. There is a then there is a dereliction of duty, and third, direct causation of to damages. So these were the 4 Ds which we have been always taught from the undergraduate to the postgraduate level. Duty of care includes the healthcare providers owe a duty of care to the patients, and they are expected to provide treatment that meets the expected standard within their field. Now, when there is a dereliction of duty, is a breach of duty which occurs when a healthcare provider fails to meet the standard of care expected to them. Now, this can include errors in diagnosis, treatment, surgery, medication, administration, or failure to warn patients of known risks. Now, direct causation means by there must be a direct causal link between the healthcare provider's breach of duty and harm suffered by the patient. So, it means that the patient injury or his condition which is worsening, which is degrading, there must be a direct causal relationship, direct result of some action from the healthcare provider. Damages, there should be some damages. Before there are damages, you cannot say anything that is a medical negligence. So there must be a direct causal relationship causing a damage to the patient as harm which has been resulted due to breach of duty. Now, harm can manifest in various forms. It may include not only physical injury, but it also extend to emotional distress and financial loss. Many cases are coming just because of the inclusion of or damages to the financial basis. So, or it may always lead to the worsening of the patient's conditions. Now, when we say that we should center ourselves to patient care, So what are the points which should be considered when we are saying that we should prioritize ourselves to patient care? It is their patient preferences. They should be well informed, educated, coordination between the healthcare workers and healthcare provider and the patient, emotional support, physical support, comfort, their integration with family, friends, continuity, and transition. So these we include that we should prioritize patient care as necessary to the ethical practice of medicine and healthcare. Then we should patients entrust their well-being to healthcare provider and expecting that they should receive high quality of treatment, compassion and effective care. Now, tailoring healthcare services to meet the individual needs, preferences and values of patients enhances their overall experience and outcome. Next slide we will see how we can look after what are the preferences and while we are handling our patient. Patient safety. Healthcare provider must prioritize patient safety by minimizing risk, preventing errors and implementing protocol to safeguard patients from harm. There are various things we have simply depicted by a pictorial presentation, that what analysis, hygiene should be proper, instrument sterilization, these are the many things, guidelines, proper SOPs, proper guidelines if followed, we avoid such negligence cases. Then there should be prevention, bacterial of infection and enhancing of patient safety. This is the must need which we usually do not see or we avoid or we just go ahead of this in the present time is the patient autonomy. Now, when previously or in many background of a country, the patients were considered to be not well educated, not well considering that they are not and they will not understand the diagnosis, the treatment, and the management. So the doctor used to inform them, well inform the patient about what will the management plan, what will be the treatment plan. But now, seeing this changing scenario, education level, digital level, patients come well informed. They are already well informed by all this Google information and everything, and they want their own autonomy. They want to understand that what have to be done. They want to be well informed before any decision about them to be and taken. And this thing the healthcare provider should understand, that the scenario has changed. They should avoid prejudging of patients. Respect should be given to each and every patient's autonomy, and there should be an agreement to this treatment to be taken. They should be well informed and well coordinated. Then collaboration between patient and provider regarding decision making should be very much in balanced ways, that will avoid any further changes in any further charges of medical negligence. Just to give a break to the monotony, I will just refer few cases which I observed during our experience. So this was a case of 32-year-old man who has underwent ERCP stent surgery for biliary obstruction and tragically passed away within 24 hours. Now the hospital faced allegations of negligence, and I would say that this was done by an MCH person. ERCP on record was done by a MCH doctor. Now, MCH not, he was a DM gastrologist. The hospital faced allegations of negligence from the attendant during the post-mortem examination. So the patient passed away within 24 hours of this ERCP surgery, and when they came for the post-mortem examination, what we found was the entire body absolutely showed yellowish discoloration with no significant external findings. Now, when we stood into the organs, our organs were pale, and there was a 12 centimeter long tube-like structure was present perforating at the duodenal jejunal junction. First perforation was 2 by 1 centimeter present at duodenal jejunum junction, and second same size 97 centimeter ahead from the first perforation at the antemesenteric border of intestine. You can see these perforation duodenal perforation. And this is this tubular foreign body, stent-like looking, which has perforated the duodenum. Peritoneal cavity was filled with 500 ml of free blood, and the cause of death was ascertained to be hemorrhagic shock due to intestinal perforation. And yes, there was some type of therapeutic misadventure or anything which may lead to the threats were leading that something has gone wrong during the procedure ERCP. And further it has been gone to the referred to the case. This was the only the postmortem finding till which we were knowing, and we gave the cause of death and referred it all. So let's see what happens in the future. This was a second case. Yes, this was a case of a middle-aged woman with full-term pregnancy admitted for delivery, and the patient died. Yes, the medical negligence cases coming are very much more common in pregnant during the time of pregnancy, death after during or just after pregnancy. They are the most common referred cases or coming for the postmortem examination as alleged cases. And in this case also the patient died after 6 hours of admission, and relatives elected the hospital for delaying in providing treatment, and no doctors considered us. We were sitting for 24 hours for 6 hours in the line, and nobody came to see and observe. These were the allegations which were all put on, and it came for the postmortem examination. And it revealed our visceral organs were pale, or chambers of heart were empty, uterus was enlarged, wall thickened, full-term dead fetus attached to the placenta. Now the placental examination showed a low-lying placenta completely detached from the uterine wall, with excessive blood clots being present between placenta and uterine wall. Now you can see there is a complete detachment. There are this postmortem blood clots were seen. There was detachment, and the blood clots have been present between placenta and uterine wall, and low-lying placenta was present. The fetus on examination showed caput succedaneum, and postmortem examination indicated that the case was of obstructed labor, and demise resulted from hemorrhagic shock due to concealed placental abruption. Now it was supposed that the patient doctor either misdiagnosed or missed the emergency of the operation, and we just reported this as a cause of death. And yes, it is reported that the obstructed liver could have been due to the caput succedaneum, and it led to abrupt placental disruption, but it was concealed hemorrhage. So the doctor missed the diagnosis, that he missed that the bleeding, absolute bleeding from the vagina, and it resulted into the sudden death. So when we see what are the root causes of human error, we see there can be concentration error, there can be some procedural steps which were omitted. Now there can be training which was misunderstood, or it can be just a poor communication, rushing, or it can be missing training, or it can be just a procedural incorrect, like we saw in one of these our case. Now, if you see what we have still far, what are the causes, how we can, which lead to the medical negligence. Now, how we can prevent medical errors or strategies for it. So these include, if we follow some procedures, some SOP, something. The first of thing is that standardized protocols or checklists should be followed up. There should be effective communication. Third, patient education. Fourth, medication safety measures. Fifth is the clinical decisions for support system. Error of reporting and analysis. Root cause analysis, training and education, and continuous quality improvement. These were some strategies which came out. Now, if we go into a little detail into each of the strategy, the first which we can say is the standardized protocol or checklist, which is a very good method when going into any surgical method, any surgical procedure. There should be a standardized protocol, checklist, number of counted up checklist, and clinical process that can help reduce the variability and minimize errors. Now, these tools serve as reminders for healthcare providers to follow the best practice and adhere to established guidelines. So we should consider that a checklist is present over there for all, for not only the healthcare doctors but also the paramedical staff present at the surgery, OTs and everything, to checklist that if everything is according to the protocol. Now, this should be a structured communication tool. This is going into that detail. A standardized protocol documentation is the best practice. Many times, our health provider just miss up the proper documentation of the of any procedure or anything as interventions or done properly. And even if you go into the peripheries, you will find that even the anesthesial notes are also not, the clinical notes, the critical care notes are not being put at right time in many of the private practitioner. That should be confronted and that should be avoided to avoid any medical negligence cases. And it is essential part to have accurate detailed recording of patient assessment, interventions, outcomes, communication given and the continuity of care to avoid any allegations. And yes, there is enhancing communication and patient education. We must tell and consider and understand ourselves also, like this comic says that your doctor is not a mechanic, he is a doctor. So he is not a god, he is not a mechanic to change everything and see everything like mechanical object, and he is a doctor. And so imparts patient education have its own importance. Effective communication where there is a failure in the healthcare system, giving time to the health to the patients to detail them is very much essential to avoid any type of critical error. Education patients about the medical condition, treatment options, self-care practices, to empower them to participate in it. It is now the things have been changed, and it has changed to equal participation of both patient and healthcare person, to reduce any likelihood of error, any likelihood of misunderstandings and non-compliance. So what is important is clear and timely communication. Standardized communication tools have been come into the background, such as called situation background assessment. There are many tools, hurdles, bedside rounds help streamline communication to understand and patient safety. Medication safety measures. So this is implementation of medication safety measures, like now there is computerized physician order. So one was so that handwriting mistakes and something those. Then there can be a barcode medication administration. So here a barcode fixed things goes on. So there is no change, because there many time there was a case also for just a the patient claimed that some other injection was given to a child. It was a child patient, and due to sudden reaction of the child, and he just suddenly succumbed. And it might be due to the adverse drug interaction, or it may be, or the allegation was of medication error, that another some type of drug has been given by the paramedical staff and which resulted into the sudden death. So this is another important issue which should be considered and managed upon. Clinical decision support system can be gotten. These are presently working in many of the countries, integrating clinical decision support system CDSS into electronic health record. And nowadays, like the health information system, lab information, these maintain the record online and digital, and so there is no misinterpretation or mismangling of mismatch of the data with other patients and other things. And they give a real-time guidance, alerts, reminders. Many of the corporate hospitals, goods one are operating this. They are taking over these things to reduce any type of error, human error while providing decision system. Now, error analysis. If something error reporting, if any there is a drug reaction, if there is something that should be reported, there should be a transparency and accountability where healthcare providers feel comfortable reporting error. Now, what happens like small errors, while something errors, because of the terror of terrorizing and this tormentation by the legal system, they don't report the errors. They don't report the actual. How can, when we don't report error, we cannot improve our system. We cannot learn further how to avoid this error. So what we are presently facing is that we avoid reporting any error, and unless and until it turns into a whole disaster. So I think there should be a way and a comfortable system when the normal error reporting that there may be some therapeutic misadventures while doing some surgeries, something been done, but they should be reported. If this, for example, that this stent one may be due to some therapeutic misadventure, but what happened, how it happened, why did it happen, that should be reported properly to avoid in future such type of errors, to prevent future errors. So this system we need to be include and understand and evolve. The root cause analysis is conducting thorough root cause analysis following adverse events or errors. So there should be an analysis, understanding why and how and why these communication, or whether there was a system failure, whether there is human factor involvement or some organization failure or some intervention failure to which resulted into the error. So that can only help us avoiding or prevent the future errors. And apart from the negligence cases, we should consider that as a healthcare sector we should avoid how can we prevent these errors in future and promote health for our patients. Now, interdisciplinary collaboration is must. In this coming time, we all have understood that nobody alone is a perfect, and we can only be perfect when we work as a team, as a interdisciplinary collaboration, many branches working together. So that is the only solution at the present time to improve health service. So we should encourage collaboration, open communication among healthcare professionals to different disciplines, fosters a team-based approach for care delivery. Health literacy and patient education, as discussed earlier, is important. Actually, not only the Google, but they should be provided the actual education of health literacy by reliable resources of educational materials, visual ads, language interpretations, and enhanced communication empower patients to make informed decision about their health. Training and education of healthcare provider is very much important, that there should be continuous quality improvement, continuous in this upgrading world with involvement of new technologies each and every day. We need to be updated, we need to be but there should be a continuous improvement for every healthcare provider. They should track their performance, and there should be proactive measures to prevent errors and enhance patient safety over time. Audit and feedback is one thing which there is nobody considering at present time, and even in the government colleges, private hospitals, small scale hospitals, audit improves the quality of health which is provided. And if a good audit by reliable resources with the intentions, with the motive of improvement, with constructive feedback is done, that will definitely improve the healthcare services and reduce medical negligence cases in the future, because it ensures compliance with the documentation standard and regulatory requirement. So why, if we see that blood banks, there is a regular audit being done by a national authority, NACO team, and if you see that they are, because of this regular audit, which is always a constructive feedback or constructive thing, there is not a pinpointing or a demoralizing thing, that always help a blood bank to improve in government sector. And they give aids to them, they provides extra funding for them, and because of this is that the blood bank at government colleges and the government sectors are still at places are running very fine. Legal and ethical consideration should ensure documentation integrity, confidentiality, compliance with legal and ethical standards is essential for protecting patient privacy and minimizing legal risk. So at these three, there are legal things that we should always keep concerned. Documentation policy should be there, accurate record maintenance should be there, patient information should be safeguarded. Any because of this digital world, many times now patient information is very much at risk of exposure to the unauthorized persons. That things have to be noted down when we have into walked up into the digital world, because that things also lead to many legal cases. allegations. Now, when we say legal compliance, which we should consider before entering into practice, because here many times they fall back because of the because of poor knowledge about the things, is are these points which should be considered as licensing and credentializing. Then we should be knowing about the regulatory agency at local, at regional level, from which permissions have to be taken. Documentation and record keeping is must. Informed consent, when, who, and what type of consent to be given and taken. Billing and coding compliance, the main consumer protection under CPA, there are a lot of complaints daily about the billing, coding, compliance, and the issues raising about from there. Risk management and liability protection. Now, compliance program, reporting obligations, and legal counsel and consultation has now become the new norm for establishment. In a very short form and exposing to us short what we mean in these licensing is that healthcare provider must obtain and maintain licenses, certification, credential to practice legal in their respective fields. So there are many licenses, like we have to take the NOCs from the fire, we have to take the NOC from the BMW. There should be a board certification in case of a blood bank establishment, in case of hospital authority. So these all licenses are mandatory and should be all should be considered before entering into. Regulatory agencies at many places, they are other than our there are places like regulatory agencies of CMS, Centers for Medicare, Medicaid, Food and Drug Administration at our place, the Joint Commission and Health, where should be considered the guidelines and their requirement. Documentation and record keeping is a must. Maintain accurate, complete, timely documentation of patient encounters, medical records, treatment plans, and informed consent forms. So when we go through when we get cases of allegation, we usually see that these medical records are all deficient and they complete it on the last moment of when these alleged cases. So these things should be keep noted, and they are important thing when we are considering about the healthcare provider practices. Informed consent from patient before performing medical procedures, surgeries, or treatments. Ensure that patients are adequately informed about the risk, benefit, alternatives, and potential outcomes of proposed interventions as required by law and medical ethics. Billing and coding is they should adhere to the billing coding regulation, which may differ from some state to state also in our places. Accurate documentation, appropriate assignment of procedural code, and compliance with billing guidelines. Implement risk management strategies to identify, mitigate. Now, whenever there should be a strategy for with every hospital about the risk management, which should be installed at many places, that which should be followed upon, and considering the regular risk assessment. Compliance program are needed that develop and implement compliance program to promote adherence to legal and regular authority. These programs actually they involve training, internal audit, monitoring, reporting. These all small things are improve the quality of the healthcare services. Understand the reporting, yes, where we say that the medical error, something infectious diseases, some abuse or neglect. We have observed many girls under 18 which have been reported with the STDs, and they are never reported for any abuse or neglect, and they are just given a treatment and went away. So these considered, these may further in future may be considered as a medical some negligence case something. And if there is an obligation of reporting many situations like in the COVID-19 cases, there were obligations of reporting infectious diseases, abuse cases, neglect. So these should never be they should always be complied upon with legal mandates. Legal counsel and consultation is the new forward coming forward, that it is a legal counsel and you can take consultation, and there are many legal firms now coming ahead for the protection of the doctors or the healthcare providers. You can take them, you can employ them in any legal matters. They take over the years, and they take out like a full bond of 3 years. So there is a new concept in lighten. Now, like with the trending future trends and changing trends, We will suppose that in the future time the medical negligence mitigation cases will also change up, and they will change in many scenarios, like the upcoming of the things like the telemedicine and digital health. They will install in the future, and there will be new problems which will be leveraging about the telemedicine platform. They are still, now they have started coming upon how to handle them. We are still unsure how to handle the telemedicine medical negligence cases monitoring. We are planning, and there are no notified or on paper policy how to handle the telemedicine and digital health litigation cases. And they will enhance diagnostic accuracy, we know, yes, but reduce errors in virtual health care. But still there will be a new era of litigations. Precision medicine and personalized care. Advances in genomics, biomarker, precision medicine, they were expected to transform. These will definitely a new era of healthcare delivery system will be coming, and future trend may focus on integrating precision medicine. So what we are today will improve to a precision medicine where there is all these involvement. This collaboration will lead to an increase in healthcare services. AI and machine learning, the new trend. We have already seen many presentations on the AI, the future trend, and we definitely know that deploying AI powered tools for error detection, distance, decision support to mitigate medical negligence cases will rise up. Healthcare data analytics, as previous slide we have already learned that they are the needed trend, they are the new trends, and we must be showing, we must be harnessing the big data analytics. We must be know about modeling techniques, and future trend may include leveraging healthcare data analytics to identify trend, pattern, outliers, and associated with medical errors. And to prevent adverse events, we must know how to handle and how to learn about the data analytics. Patient safety culture has been improving, has been the next norm. There should be a culture of patient safety, transparency within healthcare organization, and it will always remain a cornerstone of medical negligence mitigation. So, in future trending, our enhancing patient engagement, open communication, empowering of patient autonomy, for providing patient proper education and about health education, and will definitely reduce errors and prevent harm. Regulatory reform and legal innovation are to be needed. They are the anticipated changes in the healthcare regulations and legal frameworks may influence medical negligence mitigation strategies. So, it is the next streamline. These regulatory reform, legal innovation will definitely streamline malpractice litigation processes. Interprofessional collaboration, as we have said, that is the new concept, and it has to be evolved. Teamwork practice has to be increased for mitigating medical negligence risk. Quality improvement initiatives, continuous quality improvement, continuous medical education, and continuous upgradation of the health education and health knowledge about the providers is to be needed. Future trend may include implementing data driven quality improvements initiatives, adopting evidence based practice. Evidence based practice is very much being used up in the present time. Embracing a system approach to address underlying root causes of medical error, how to report, how to tell, that method needs to be improved and ease, and so to prevent the adverse events. So with this, I would just say thank you to all to listen to me and give your ears for the 1 hour. Thank you, sir.
Thank you, Dr. Richa. Yes, any questions from the panelists or the audience?
I have some issues regarding medical negligence. Can I
Yes,
raise
please. Yes.
First thing is regarding privacy. In our scenario in Bangladesh, recently incident has happened that a person suffering from cancer, CA cancer, CA gallbladder, and the doctor did not inform that to his family, and ultimately he died, and his license has been suspended for 6 months. Actually, regarding the privacy, we know that any person's diagnosis or medical history should not be given to other, even his or her relatives, without his or her permission. So, in this case, what is your opinion on how do you handle it in India? In many cases, the relatives or family members do not want that his or her diagnosis should be known by the patient. But it is the right of the patient to know his or her diagnosis. So this is one issue. Another issue, what about the Bolam test to detect the negligence? I think in India, the Bolam test was introduced first. But what about the Bolam test in India? Is it used in India for detection of medical negligence? And last one, in Bangladesh, when there is a death, whether it is wrong or right, media, electronic and print media give the news like that X has been died due to wrong treatment. Before complete decision or complete identification, either it was wrong or right. So I want your opinion regarding these three issues.
Sir, regarding your first issue, I think that was a carcinoma gallbladder. What I got and what I understood that you were telling there was a patient of carcinoma gallbladder.
Yeah,
So, how to disclose the things to the patient or the patient relative, right, sir?
Yes, yes.
About the privacy. So, I think here lies the phenomenon of the effective communication. How to disclose a serious or grave thing or grief reporting to the patient or patient relatives, and yes, they should be reported. What it's considered that unless and until they fall into the confidentiality level, there is carcinoma gallbladder is nothing that should not be reported. So I think they should be reported, but how that should be communicated, that includes grief counseling. That is a new word where it includes that there are grief counselors, that how our serious ailment has to be disclosed to the patient relatives. So they are trained, well trained persons, which through effective communication, dealing with them at their language, at their avoiding the language barrier. Language barrier is the main thing which comes between the patient and the doctor or the healthcare provider. So there are specific grief counselors which may disclose such serious ailments to the patient relatives, and proper informed about the stage at which the patient is presently, how is the disease progression will go, what are the treatment level which can be provided to the patient, and how the further management is there. So what we tell students and all, that there should be a proper communication between it is not definitely that the proper doctor only is present there, but there are counselor which may directly deal with the relatives or the patient itself also, and they should be exposed to all the treatment methods and given autonomy to decide with complications for future what may arise with each of the treatment. So at this level they should be properly told. Bolam test, I don't know. Second question, presently what? Yes, it is a method which was used, but how precisely it is been used, I think somebody else or senior may better tell. What is the present scenario and how precisely it is used. Yes, the concept is behind, and the main concept behind deciding any litigation is this same concept as the Bolam test, but it is an old word and not in present much use actually over this place. What was your sir third question? I just missed it out.
Oh, the third question was, in our sitting in Bangladesh, sometimes the newspaper and electronic media express the news like that one person is died due to wrong treatment directly, without deciding the treatment was wrong or not.
Sir, actually, news media is no media to decide whether the treatment was long or not. So we here also we don't consider what news media is usually misguided, and they are not the deciding factor. The deciding factor over here is never a news media reports. They always misguide. They may usually misguide, and they are not to be deciding factor. What are the deciding factors? Are the reports and the actual reports which come through. Either it can be the records, documentation, the committee which is set at local level or regional level, whether it's the case established or at the state NMC level, anywhere where the cases has gone up. So they are the deciding persons, and it is evidence based practice. Evidence decide whether it was allegation or not the allegation, and to my understanding, this is the thing, sir.
Problem is when this type of news come out in newspaper or media, it creates problem for the healthcare providers.
Yes, yes.
So how it can be it should be handled.
Yes, there is no policy that when our newspaper, now that's in India also, that newspaper and media have gone the full liberty that before any cases have been done, they go on and they can, there is a freedom of press. And yes, there should be a policy, I agree to at this point, that whether how, and this it sends a dispute of the healthcare provider if the case comes false. I think this is thing you want to enlighten. Yeah, this that is it is like a mental torture if a wrong case is just highlighted in a news media. And yes, they presently also over here also there is no strict guidelines regarding this, whether it should be published and when to publish or not to publish, and whether we can say. But yes, previous there are laws coming which are in support of the practitioners. Nothing to say about the media. There is no control over the media, but to the control of arrest, to the control of case allegation, there have been a control in the news system. And we suppose that yes, news media should also be, it is just left to them to be sensible enough to report such cases.
Thank you very much.
Thank you, sir, for
Is
your.
there time for one more question?
Short one.
Okay.
Yes.
Dr. Richa, I gave a comment. You must have seen that. My point is this, something else. Often we face the difficulty in public media because the next of kin, the NOK,
Sorry to interrupt, sir.
insists
Your
that.
voice is not clear, sir.
Can you hear me better now?
Yeah,
Can
sir.
you-
Just raise your
Sir,
voice.
sir,
Okay.
is it audible to you clear, or it's only to
Yeah,
me?
it's audible. Can you hear me now?
Yeah, it's okay.
Okay. The issue I wanted to raise was sometimes we face in the public media in India the next of kin making a big noise because they were not consulted about the line of treatment and this and that. I was wondering whether we could have guidelines in our hospitals to indicate the chain of consent so that we don't face this problem that the patient consented to something and if something went wrong, the next of kin made a noise. They never asked our permission to do this particular thing. The hospital has made a mistake.
Sir,
Did you
Imran sir,
understand?
I'm sorry, I'm not able to get the understand what is not audible to me. So can you elaborate what was sir's one?
Okay, I think Dr. George, we can you can write the question.
Okay, no, am I better audible?
For me, you are audible, but I don't know about.
You can't hear, Dr. Richa?
Yes, sir.
Okay, my question is basically this, that,
Yeah, now it's good.
okay, I took off my headphones.
Okay.
The question was that, we often see in the press issues raised by the next of kin that when the person had consented to some surgery or something or treatment and it went wrong, the next of kin claimed that they were not consulted and therefore the hospital was at fault or the doctors were at fault. So I was
Yeah.
wondering if we can have a system by which, as one of the things put up in the hospital, when people come in, it is clearly evident to them who has a right to give consent, the patient, if conscious, then fit and fine. Otherwise, the next of kin will be consulted. If the patient is fine, we will not consult the next of kin. It is a patient's consent. Can we, I mean, we may set up a system like that. Is it possible? What
Agreed,
do you think?
agreed, sir. There are cases coming like this that the patient was told and everything was told, and the next day, if something goes wrong, the other person, a far relative or something else, that I am the closest relative, why wasn't I informed about this thing?
Yes.
That are the cases, definitely, sir. And we need to have, this was a discussion down at somewhere, I don't remember, that this was a discussion down that how can we get something, or there's some rulings about this, who has to be informed, who is first, and who is the more responsible person, who could take responsibility about the decision making. I agree to that, sir. And I think that should be formed up. The guidelines should be there, that whether for the patient is there, that or the parents or the closest kin, who is the closest kin? Is it the wife to be informed, or is it the parents of the person, or is it the son of
Correct.
the person? So the
Yes,
relation
yes.
in India are very complicated, and everyone is close to the person at the last moment to hire, to put on the litigations. Agree to you,
That's
sir.
right. Yeah, but I was wondering how much this would be helped if we put out a big notice saying relating to consent for treatment and surgery. This is the protocol. If that would help the hospital and the doctors.
Yeah, that could be
No,
done. That
because you see,
hospital can themselves give the guidelines.
because if you have guidelines, but it's not in the public domain or to the patient and the relatives and the press as soon as they come in, then it's something which is in your drawer. It doesn't come out in public.
Yes, sir. Yes, sir. That is very important. I think that could be done. That we can only give the guidelines first of all from the hospital side only. That these are the closest person which will be taken into confidence.
Yeah.
That is a
Thank you.
good thing, sir.
Yes, thank you, sir. Thank you,
Thank
ma'am.
you, sir.
So even if the questions you have, you can type it in question answer session. Dr. Richa will answer. Now, since we have limited time, we are already exceeding our time. Our next presenter is Professor Amarnath Mishra. He is one of the youngest coming forensic scientist nationally in India, and he is working currently as associate professor in MET Institute of Forensic Sciences, and he also worked as founder head of the institution and professor at Lloyd Institute of Forensic Sciences, Greater Noida, Uttar Pradesh. He is PhD in forensic science with a specialization in forensic and analytical toxicology from Sam Hing Botton University of Agriculture, Prayagraj. Dr. Mishra has published 7 books and 27 book chapters and more than 65 scientific articles in good and reputed journals. He is also the supervisor of the PhD students at various topics, including DNA typing and analysis of anesthetic drugs, as well as his own specialty, toxicology. And Dr. Mishra is also a recipient of Academic Excellence Award, internationally distinguished academic leader award. He is NABL Empowerment Technology Assessor for ISO IEC 17025. He is also a forensic expert and medico-legal consultant for the Court of Law under Section 45 and 65B. So if you see that he have many things, he is a multitasking man with highly innovative approach and attitude towards forensic medicine. So it is our pleasure that he is with us today here. Dr. Amarnath, can you share? Yes, thank you. Yes, please, you can start your presentation.
Thank you, Professor Imranji, and thank you all of organizing team members, and thank you for organizing such an internationally conference in the field of forensic medicine and sciences. So here, first of all, I want to tell everyone good evening. I hope in every places good evening and also good morning if anywhere. Now I want to start with my topic, recent advances in forensics. As per concept of today theme, so when we are considering about topics. So what is the recent advances or what is the new technology or new things which are going to advancing the field of forensics, forensic medicine and sciences? That is very important. When we are talking about forensic science or forensic medicines, so there on the daily basis, there is the trend of crime is going to change. There are different types of poisonic substances going to find out from the dead body during the autopsy. There are different symptoms, there are different changes in the body. When we are talking, so there are different technology which are using for the conducting the crime. So there is a requirement of new equipments, devices, and software to solve such type of things. As per the amendment in the Indian Evidence Act and Indian Penal Code, and in many, when we are talking about the global scenario, there is the importance of scene of crime, because without proper examining the scene of crime, we are unable to find out the proper physical evidences, and without that physical evidences, we are unable to solve the cases, and we are unable to reach at the point where we require to go. Also, when we are talking about forensic medicine, so there is a virtual autopsy nowadays, raising as also people of that field also emphasizing on that we need to remove replace traditional autopsy system from the virtual autopsy. But yes, there is many limitations, as Professor Guria sir is also said in his presentation. So there are many recent advances which we can implement, and we also want to know about that things. So I'm going to start with the first slide. The role of forensic science has immense importance in the legal system, although it would not be wrong to say that this field has shifted its positions from a supporting role in criminal investigations to a broader subject which has evolved with time and now is used proactively in cases related to criminal justice system. Since the criminals keep on developing more elaborate methods to evade arrest or detention, forensic scientists often had to come across new challenges in cracking different cases by analyzing complicated evidences. However, advancement in technology have also provided forensic science with powerful tools and techniques to tackle these challenges. So here we are discussing about automated firearm identification, blood pattern analysis software, mass spectrometry techniques, sensitive detection methods, omics techniques, carbon dot powders, artificial intelligence, nanotechnology, and proteomics. So what happened when we are talking about the forensic fields? There are many specialization. When we are follow any forensic medicine and toxicology book, so there is the identification, there is the history of forensic medicine, how that evolved from basics. Okay, so that is important. After that, identification is required. When dead body come in a mortuary house, so proper identification, if that is a known dead body, so we are going to take fingerprints or any other ID proof. That is identified by someone. If not, so we can also opt for like a photograph match or in decomposed body, the DNA and other things. And after that, there is the autopsy techniques. That is the basic techniques for the performing the autopsy. Now, when we are also using about virtual autopsy, that will be helpful, because when we are talking about mortuary houses in the developing countries, so in some mortuary houses, if there is a case of firearm injury, as per the guidelines, we also need to take X-ray, so we can also know the track of that bullet, and if that inside that lodge inside the body, so we can also easily detect. But such type of facility is not available. But yes, when we are talking about tertiary care hospitals, so they can also establish virtual autopsy and other things, and they also going in a proper manner to perform the autopsy. Like when I visited Institute of Medicine in Kathmandu or in Aligarh Medical College. So what happens, such type of things are required. But now in some medical colleges, there is the establishment of forensic toxicology units for the detection, preliminary examination of poisons. Also, they can also develop, DNA profiling section, like when we are talking about AIMS, New Delhi. Also in future, we can also develop about firearm identification systems. So there are many many proposals by the senior authorities that there is some basic laboratory, some important facilities required at Department of Forensic Medicine and Toxicology all over India, and also in developing country like Nepal, Bangladesh. Like I visited Dubai Forensic Science Laboratory, so they also having the Forensic Science Laboratory, and also there in lab there is a mortuary house that is not only established with the Forensic Medicine Department. There is separate things developed. I like very much that system. So when we are talking about automated firearm identification, so this is very important. Generally, in forensic science laboratory, there is the forensic ballistics division. But problem is that when we are determining the range of firing, so such type of system is not proper developed. When I'm talking about this is the range of firing at NFS Gandhi Nagar, that is a good facilities there, but in some state forensic science laboratory, they are having the problem in the range of firing, or that is the basic setup. So we require to enhance. So when we are talking about automated firearm identification, that refers to use of computers to automate the process of matching a piece of recovered ballistic evidence. So as a faculty of the forensic science and medicine, when we are teaching, so there is the individual and class and individual characteristics to identify the bullet, that is projectile, and we establish the cases on that basis. Just like fingerprints, just like face recognition, just like other biometrics, if we put both bullets that fired, that is the suspected, that is the case sample, as well as a test fire. So that automated firearm identification can help for the identifying, that is same bullet, same that fire from same firearm or not. So such things are very helpful for the solving the cases of firearm related crimes. The ballistics scanner, which capture the images of bullets and cartridges, the signature extraction units, which uses a mathematical algorithm to extract unique signatures from the images, data storage unit, which serve as the main storage, the correlation server, which handles the actual comparison of images. When we are talking about data banks of the fingerprints, so India in this country, we are also developing the data banks for the fingerprints. when we are talking about Aadhaar, that is also saving up the fingerprints and other biometrics. When we are talking about Western countries like US, Canada, UK, they having the data bank. Problem in data bank for the DNA in India or in some developing countries. So in this scenario, when we are talking that how many firearms, licensed firearms in the market, there is a country-made firearms. So we are unable to make the database of all firearms, but that license or standard firearms, we can make the database of that particular identification, individual characteristics of particular firearm. But that is time consuming. So we can do that when such type of firearms coming in such type of cases. So we can go with that bullet that found from crime scene and test fire bullets, and we are going to compare. So key features of automated ballistic identification system, electronic bullet and cartridge case, repositories of unlimited size, automated record keeping of registered firearm, automated trace examination of bullets, cartridge cases and fragments, identification of firearm by marks on live fired bullets and cells, inter-regional firearm data exchange. This is the examples of that automated ballistic identification system. Now, when we are talking about blood pattern analysis software, so blood pattern analysis that is helpful in crime scene investigation. How, on the basis of when we are talking about different types of injuries, okay. So when we are talking about blunt force injuries, sharp force injuries, so I'm talking about blunt force objects and sharp force object. And when we are talking about firearms, so these three types of weapons, when anybody going to any person A going to kill to someone person B by any weapons like blunt force, like sharp force, or by firearms. So on the basis of the velocity of that weapon, there is chances of bleeding. There is the blood. Okay. So on the basis of that blood pattern, that blood is spreading, we can also understand about the velocity of velocity, and on that basis we can identify, we can guess about which type of weapons is utilized in particular crime. So we can get idea about a weapon. Then if that is that person that firing or that any injuries from the high surface or range, so that is from that pattern is also showing that patterns, and on that basis we can also know the height from the firing or impacting by the sharp force or blunt force objects. So we can determine such type of thing, and that is very beneficial in developed countries, such type of things utilizing. And also in the advancement in crime scene investigation, there is 3D crime scene scanner, advancement of that. Also, they are finding such type things and also know the angle of impact and also get the idea about the object utilized in performing that crime. So blood pattern analysis software is helpful as analyst can use photos from a bloodshed incident at a crime scene to calculate the area of origin of impact patterns. This information may be useful for determining position and posture of suspects and victims, sequencing of events, collaborating refuting testimony, and for crime scene reconstruction. The results of analysis may be viewed in 2D within the software as top-down, side, and front views, are exported to several 3D formats for integration with point cloud or modeling software. So this is the high impact first picture, this is the medium impact, and that is the low impact. And also if that is 90-degree or from the sides. This is some examples like Hemospad, Backtractium, that is the softwares. VPA can be a powerful reconstruction tool assisting in building a picture of what may have happened during and after blood was shed. It may also be of use in answering questions such as what was the position of the victim and offender and the object at the time of bloodshed. Next is mass spectrometry techniques. When we are, this is the detector and spectrometric techniques. It is utilized when it coupled with GC, LC, and also that is the tandem mass is also there, GC MSMS, LC MSMS. So many times if there is the new psychoactive substances, designer drugs, or unknown poisons, so easily mass spectrometry going to detect, and we can find out without any control samples. So that is very helpful in the field of forensic chemistry and toxicology, and also in clinical biochemistry. Application in forensics, mass spectrometry used to identify trace evidences or microscopic traces of crime evidence. More specifically, a mass spectrometer can be used to identify toxins, medications, and poisons in human tissues, sources of clothing and carpet fibers, glass shards, paints, inks, dyes, etc. Forensic spectroscopy helps reveal various body fluids, chemical makeup using electromagnetic radiations. Comparing the resulting spectra with the molecular spectra library is the most convenient method for comprehending the chemical structure of molecules in the sample. Portable versions of forensic spectrometric instruments allow the analysis of samples' chemical composition and structure without being removed from the crime scene. Moreover, because of the non-destructive nature of forensic spectroscopy, this technique is also used to analyze unknown samples that are potentially hazardous and expensive. This is the schematic diagrams of an LC-MS setup. Now, on sensitive detection methods, sensitive detection in the field of medicine and dentistry refer to the use of advanced technologies to detect minute amounts of specific substances or changes in the body. This is crucial for early diagnosis, monitoring disease progression, and assessing the effectiveness of treatment. Techniques like mass spectrometry, fluorescence detection, and forensic imaging are commonly utilized for sensitive detection. For instance, mass spectrometry has become an invaluable tool in clinical laboratories due to its high sensitivity and specificity for identifying biomarkers and drugs. Similarly, fluorescence detection methods are widely used in biological research and medical diagnostics for their high sensitivity and non-invasive nature. Fluorescence detection is a detection method that uses fluorescence emitted when a compound returns to the ground state after transitioning to the excited state. A xenon lamp is generally used as a light source for the fluorescence detector. The light emitted from the lamp is separated into a light beam of a certain wavelength with the excitation grating and then passes through the flow cell. When there is a substance in the flow cell that receives a specific wavelength of light and transitions to an excited state, it becomes a fluorescent compound. A light emitted from the compound is split by the emission grating and converted into an electrical signal according to its intensity by a photomultiplier. This is the diagram of the fluorescence detector. Now, forensic imaging. Actually, fluorescence detector also helpful in the crime scene investigation if at the crime scene blood, male, cast, semen, so that can easily giving the fluorescence and person can identify and collect the samples for the further investigation. Now, forensic imaging is a non-invasive examination process during the forensic investigation. It is mainly used in forensic pathology as an adjunct to the traditional autopsy. In the past 2 decades, forensic imaging has been vigorously developed by forensic experts from computed tomography to multiple augmented techniques through CT and magnetic resonance imaging. The application field of forensic imaging has also been broadened as its advantages are recognized by more forensic practitioners. In addition to the forensic pathology, this techniques has been used in other forensic disciplines, including forensic anthropology, forensic odontology, forensic ballistics, and wildlife forensics. This is some pictures of forensic imaging. Now, omics techniques, the use of omic techniques in forensic entomology represents a significant advancement in the field. These techniques, which include genomics, transcriptomics, proteomics, metabolomics, and microbiome analysis, allow for a comprehensive and systematic study of biological samples. In the context of forensic entomology, they are used for species identification, phylogenetics, and screening for developmentally relevant genes, among other applications. They also play a crucial role in interpreting the behavior characteristics of species related to forensics at the genetic level. Currently, omics techniques are gradually being applied to forensic entomology research and are useful in species identification, phylogenetics, screening for developmentally relevant differentially expressed genes, and the interpretation of behavior characteristics of forensic related species at the genetic level. These are provide valuable information for estimating the postmortem interval. So this is the omics techniques and their components like genomics, transcriptomics, proteomics, metabolomics. Now, next one is carbon dart powders are known as the rising star of carbon-based nanomaterials. And by virtue of their unique structure and fascinating properties, they have attracted considerable interest in different fields such as biological sensing, drug delivery, photodynamic therapy, photocatalysis, and solar cells in recent years. As highly sensitive and highly selective optical nanoprobes, C-dots show excellent analytical performance in detecting biological compounds, drugs, explosives, heavy metals, and poisonous reactants. Capitalizing on their color tunable behavior in the sense that they adopt different colors with respect to the incident radiation. C-dot based compositions are ideal for the visual enhancement of latent fingerprints, affording improved contrast against multicolored and patterned backgrounds. So this is the fingerprint staining process and the mechanism by which the C dots adhere to the fingerprints. So how to develop, how to utilize, there are many patents in India and other countries on different types of using the green chemistry and different fluorescence powder. They are also filing the patent on these fields. We have also one patent on that. Now, next one is very interesting and discussed by other speakers also. Artificial intelligence. Currently, AI is being used to analyze digital evidence such as images and videos by detecting objects or faces within them. This type of analysis can help investigators quickly narrow down their search and zero in on potential suspect more efficiently. Additionally, it can be used to extract text from documents which may contain important clues about a crime. AI is also used to analyze audio recordings such as intercepted phone calls or other voices at the crime scene. By using machine learning algorithms, forensic scientists can detect words or phrases that could be valuable to the investigation. Experimental application of AI in forensics. Researchers are exploring new ways that AI can be used within the field of forensic science. For example, some researchers are exploring the use of automated lie detection system, which utilize voice recognition technology to detect subtle changes in a person's voice when they are telling a lie. Now, such type of cases is reporting on a daily basis. This could potentially provide investigators with valuable insight into whether a suspect is being truthful or not during an interrogation. Another experimental application involves using deep learning algorithm to analyze images from crime scene for a specific object and or pattern that may go unnoticed by human investigators. This could lead to evidence being discovered much faster than before and improve the overall accuracy of investigation. Ethical implications, privacy concern, risk infringing upon individuals' privacy rights, the potential misuse of AI technology. AI system could be manipulated to fabricate evidence, mislead investigations, or even create deep fake videos as images to incriminate innocent individuals. But as forensic, as per the Locard's principle, as the principle of forensics, we can easily going to analyze such type of cases that can take minimum to maximum time, but we can resolve such type of case. Nanotechnology is the study, design, creation, synthesis, manipulation, application of a functional material devices and system through control of matter at a nanometer scale. The word nano is derived from the Greek word dwarf, and nanostructure is an object described between the size of 1 nanometer to 100 nanometer. Nanotechnology can be applied to forensics in two ways. The first method is detection and analysis of samples in a nanoscale. The second method is the assistance of nanomaterials with novel properties in the collection and detection of evidences. This is the forensic nanotechnology application, like it utilized in fingerprint visualization, drug and pesticide detection, question document examination, explosive detection, petroleum product detection, body fluid detection, and age of dried blood stains and times in their determination. We can also implement that nanotechnology devices during the autopsy. Suppose if there is a, like we are mentioning, cause of that suspected case of poisoning. So if we having the kits about some drugs, some pesticides, there is a nano sensor. So what happened? We can also give remarks. That is the suspected poisoning, case of suspected poisoning, and also we can mention that tested by that kit things, and we found such type of test. So that will also helpful for the FSL, and also helpful FSL, like they are going to read the case history, they are going to read the autopsy finding. On that basis, they are going to conduct the spot test, then preliminary examination, then confirmatory test. So that can reduce the time. And also, and this is good because there are many cases of poisoning cases and others pending in the forensic science laboratory. So we can also establish such type of a small lab for the detection of such type of cases. That will be very helpful for the solving the cases where the population is more. So some pictures of nanoscales. Then proteomics, the study of proteins and their functions, has revolutionized the field of forensic science by providing a powerful approach to identify and characterize protein for various aims by using proteomics. Postmortem bodily fluids, tissues, and organs can be thoroughly and uniquely analyzed for protein identification and characterization. Human samples, including blood, hair, bone, and fingernails, have been subject to proteomic analysis in recent years. However, the application of forensic proteomics may run into obstacles such as unidentified samples and contaminants. So these are the messages for forensic origin for protein information. So in general, when we are talking about recent advances, so how we can utilize that recent advances in the field of forensic medicine? How can we enhance the process of postmortem examination? How we can enhance the things? So there is the utilization of forensic imaging, there is the utilization of nanotechnology, there is the utilization of different improvement in the field of identification. So such type thing can enhance the better performing about to know the cause of death, time since death, manner of death, mode of death, other all things which requires for performing the autopsy, and also for the further examination of the viscera or further examination of evidences, not only that evidences after postmortem, also the physical evidences from the crime scene. So we can enhance the process of solving the any case in the field of forensics, and we can enhance the process of criminal justice delivery system by providing the evidences in time. So thank you.
Thank you so much, sir, for your wonderful presentation. It's a meanings here a lot. So with the permission of our president, because of the lack of time, we can move into next presenter. Thank you so much, sir.
Thank you, sir.
So we move into next presenter, Dr. Bhupesh Kumar Sharma, forensic on the topic of forensic foundation, mastering crime scene evidence collection and handling and preservation. Bhupesh Kumar, sir, are you ready
Yes.
for with your presentation?
Yeah, I'm ready. Can you hear me?
Yeah, yes, sir. Yes, sir.
Okay, let me share my screen. So I can't see the share option with me.
1 second, sir.
Yeah, now it's visible. Okay.
Yes, sir.
Is my slide visible?
Yes, sir. Yes, sir. And for the all the respected participants, question and answer session will be conducted at the last of the session. Thank you so much. Yes, sir. Kindly put in slideshow, sir.
Yeah.
Yes, sir. Thank you, sir. You can carry on, sir.
Okay. So firstly, I would like to thank the organizer for giving me this opportunity to present the handling of physical evidences. As we know that handling of physical evidences is very much necessary and important. Many great speakers here have talked about so many recent advancement and technology, what we use in forensic science, what we should be using. And we heard from Dr. R.K. Goria as well, who has been pioneer in forensic medicine. But as a forensic scientist, we must all take care about handling and collection of the physical evidence. No matter what technique we use, how we use it, but if the collection of physical evidences is not properly done, and if we do not follow the protocol, so many times it has happened that the protocol has not been followed, and we have seen this in various cases in India, in very big cases in India. Let it be the case of Arushi, let it be case of Soumya, the journalist, let it be the case of Sushant Singh Rajput. So all these cases have not been solved, or there was a lacuna just because improper handling of the evidences. So I'm going to discuss about these here. So this is just brief about me. I have been in teaching and research in forensic science for last 18 plus years, and I have solved many cases for Indian and abroad courts. More than 100 papers in different conferences and seminars, as well as published about 40 articles and 11 patents. So let's go to the introduction. I will not spend much more time on the introduction, as we are already running late, half an hour late. So when we talk about forensic, we are talking about the word forum. So forum is a Latin word, so which means a group of people related to law. As we know that many of the forensic medicine experts are sitting here, so they are the part of this forum, because these are the people who help in solving any criminal case. And also the forum consists of lawyers, the judges, and detectives also in many countries now the part of the forum. And whenever any of these people or the scientists apply any scientific discipline in terms of law for the purpose of justice, then it becomes the forensic science. It may be the physics, it may be chemistry, biology, forensic, say medicine or medicine itself, engineering also, as Dr. Mishra was talking about the artificial intelligence, machine learning, and many other say learned professors also talking about so many things. So all these are expert in their field. Let's say if I need to take the help of a cyber forensic expert, so he will be a forensic expert because he will be having a sound knowledge of the cyber forensic. So no matter what is your degree and what is your qualification, but you must be skillful to become an expert in under section 45 of Indian Evidence Act right now in India, and Evidence Act as pertaining to the country which you guys are residing. So as you will see this block diagram, we can easily see that crime scene is a place where evidences pertaining to that particular crime can be encountered or may be encountered, and which may directly or indirectly be linked to the crime as well as the criminal. So forensic science helps in linking the crime with the criminal. So whatever we do to link the crime with the criminal. And if we fail to do so, so the conviction cannot happen. Okay, there is a victim, there are evidences, but we cannot link any of those evidences with any of the suspect or any of the accused. Then we are still in the unsolving mode of the crime, and this has happened. We have witnessed this in many of the cases in India and abroad. So these are the basic principles of forensic science. I will not again talk about these in much details. So law of individuality, as we all know, that everything is individual in this world. No two things can be exactly alike. So DNAs are different. Only the DNA of homozygotic twins can be alike, but in that case, fingerprints will be different. So that's why we are using forensic science in criminal investigations, because everything is individual in this world. Then we use the principle of exchange, that every contact leaves traces. If I'm touching anything, I will impart my fingerprints onto that surface, and I will take some dirt or dust or paint or whatever particle onto my fingers as well. So this will provide a linkage. The principle of exchange will provide a linkage between these two matters or these two items. Then we have law of progressive change. So everything is dynamic and ever changing. So if the blood drop is there today, it will not be the same blood drop. I think all of you will agree with me. It will not remain the same blood drop after a week, then after 15 days, or after a month, and after 6 months or so. So we need to take care of the evidences as quick as possible and as fast as possible in a properly managed manner. Then law of probability, an event can happen in more than one way. A suicide can be actually a homicide, and a homicide actually can be a suicide, or a suicide can be can happen in different ways. We should not only look for one way, and homicide can happen in multiple ways. Then again, we should not look for only one of the ways. Now the function of forensic science is basically to establish the corpus delicti, means the body of crime, whether it is a primary crime scene, secondary crime scene, tertiary crime scene, where the crime has happened. So all these things has to be ascertained on the basis of the physical evidence itself, and as per the protocol again. Then how and when was the crime committed, means the modus operandi, which is the mode of operation or way of crime. And finally, the identification of the criminal. Of course, all three of these functions should be accomplished by a forensic expert or by the people of the forum, by the police officers as well. But many times, either we are unable to accomplish the identification of the criminal, we do not know the modus operandi, or we are unable to establish the corpus delicti. So all the three should be there, but The third one is more critical, and we whatever technologies are being developed are developed just to identify the criminal actually. So a crime scene where actually the evidences can be encountered. I told you that there may, so let's say there may be a case where a person has been murdered in a closed room, and then the body has been dragged out through the staircase, and then the body has been took away in the car and dumped in the forest area or any desert area. So it involves different crime scenes here. So crime scene can be indoor, crime scene can be outdoor, crime scene can be combination of indoor and outdoor. As in the case which I discussed, there can be a combination of indoor and outdoor crime scene. The murder has happened somewhere else, but the body has been encountered in the desert, in the open desert or forest area. So it will be the tertiary crime scene. It will then be trailed down to the secondary crime scene and finally to the primary crime scene. So all this happened because of the evidences. So what we do in crime scene management, we do three major things. One is the crime scene survey, then the crime scene investigation, crime scene reconstruction. So our part as a forensic expert is mainly with the second objective, which is the crime scene investigation. Because crime scene survey is mainly done by the police officers. They go on the crime scene, they look for the location, they take out the brief history of the case, and they protect the crime scene. So the protection through barricade or through home guard or whatever, the way they try to protect the crime scene, so there should not be further decay of the evidences or further damaging destruction of the evidences. And crime scene investigation is the part of the forensic expert. Actually, in many of the countries, when I was residing in UAE for 10 years, I have seen that the police officers actually have been trained completely, and they have been given certain ranks in the police department, major general, colonel. So the forensic expert itself, say themselves, have been given certain ranks, and in many of the countries it is the same scenario, but in India it is not the scenario. So what we are facing right now in India, in many of the cases forensic experts visit the crime scene much later, till then the evidences have been destructed, and there are no more evidences, or evidences have been washed off, crime scene have been say disarranged, or crime scene have been staged. So these things have to be taken care of immediately. So but in many states, what we see in India itself, in many states now, it has been made a protocol. Even in Delhi NCR, where I live, it is a protocol that the forensic expert will accompany the investigating officer to do the investigation. And in investigation, the first thing comes is the recording of the crime scene. Because again, I'm telling you, it is not only collecting the evidence in one way, but photography or recording or sketching of the crime scene is also a way to collect the evidence, because everything is going to be misplaced after you take away the evidence or after you send the evidence to the crime scene lab. But whatever is left is the photograph or videograph of the crime scene. The court need the evidence that particular evidence was lying, or a particular firearm, let's say, was lying on that particular area. So there must be a photograph. The dimensions of the crime scene should be well defined in sketching, as told by Dr. Mishra and other learned professors, that now we are using the artificial intelligence and 3D scanning to scan the crime scene. So whatever method you are using, it should be admissible in the court of law, that we should take care of. And photography and notes should be sufficient enough. So now the second thing is the searching for the evidences. So there is an array, there is a line of searching of evidence. We should not randomly search for evidence. It depends upon the size of the crime scene. It depends on the nature of the crime, that what has happened. Then the searching method should be defined, whether we need to use the zonal method, where we can divide the crime scene in different zones. We need to use the spiral method for larger crime scene, so we can start from the center and then we can go towards the periphery of the crime scene. They can be grid, strip, and wheel method. And finally, once we search for the evidence, we collect the evidence, and then we send them for forensic analysis in the forensic lab. But what happens here in, see, any success or failure of a case depends upon completely how the evidence have been dealt with, how the evidence have been recorded, how the evidence have been collected. Again, I would like to say, no matter what technique you are using, it will only come after once the proper collection of the evidences has happened. Now, crime scene reconstruction is all about the documentation, hypothesis created, creation. As I have told you that an event can happen in more than one way. So we need to create probable hypothesis. Then we need to work on the probable hypothesis, that what can be the most convenient or most fitting hypothesis in this scenario. And then the final reconstruction to show in the courtroom. Now coming to the physical evidences, the physical evidence can be anything in any state of matter. It can be solid, liquid, or gas. It can be physical, chemical, or biological, that can link the crime with the criminal. So there can be a firearm. Firearm is a solid evidence. Now, firearm can have some blood stain that may be in the liquid form, or that may be in the solid form. Dried up stain can be there. There may be some gaseous evidences. You might be thinking that what can be the gaseous evidence. Let's say if you open my wallet and if there is a smell of cigarette or a smoke, and when somebody enters after smoking to our house, immediately we came to know that the person has smoked. So there are gaseous evidences also, and there are different protocols to collect these gaseous evidences. So evidences can be found in any state of matter. What we need to take care as a forensic expert, what is that state of matter, what evidence we are dealing with, and what state of evidence now it is. Now blood can be in liquid state, blood can be in solid state, and there can be any volatile substance in blood, that can be alcohol or something, that or alcohol directly lying on the crime scene. And according to law of progressive change, alcohol is volatile, so alcohol is not going to remain for a long time on the crime scene, and we need to take care of that principle as well. These are few types of physical evidences that have been categorized. There are different categorization of physical evidences, but I have used this to minimize the work here. There can be biological fluids, there can be impression evidences, which may have fingerprints, footprints, footwear marks, tool marks, bite mark, lip print, all these, and caution documents. Most of the cases in India and in any developing country are related to the caution document. Let it be a passport, let it be the fake currency, let it be handwriting signature, property papers, wills, secret writing, now electronic documents, text messages, WhatsApp messages. So forensic, linguistic, and caution document work together. So again, the collection method and analytical method of these evidences are entirely different from blood, semen, saliva, or other evidences. Then we can have the trace evidences. We can have hair fibers, pinches, which may be overlooked by even a learned investigating officer, because he was in rush, he has to go for another crime scene, or he is having so much of pressure of media or politicians, or maybe some other kind of pressure. So he may overlook certain trace evidences. So most fragile evidences should be looked first, and then we can go for other evidences. And similarly, there can be chemical evidences, any explosive, petroleum product, drug, acid, bases, or medicines, and then the tools can be there. Now, main source of physical evidence, why I'm putting this slide here, though we all know that the physical evidence either will come from the victim or will come from the accused, the suspect. But the crime scene is sharing its evidence. The crime scene is sharing the material with both of them, with the victim as well, with the suspect as well. So crime scene is that place from which the evidences can be encountered on both the parties, the victim as well as the suspect. So we need to look for those evidences first, that what has been shared, what might has been shared by the crime scene onto the victim and onto the suspect. And suspect, let's say suspect might also be coming from some environment, some place. So he may bring many of the evidence with him, maybe soil or dirt particles in his shoes, or maybe any other coloring material, or he might have bought some weapon from a shop, or so he is also creating a trail of evidence. So we need to look for all these evidences. And again, I will tell that the collection parameter is all different, but what we should do currently, whatever we are seeing, whatever we are visualizing, so we should photograph it with the latest technique, whatever is available. Now, location of the physical evidence is another challenge when we are collecting the evidence. A blood stain on the wall will be collected in different way. A blood stain on the floor will be collected in different way. A blood stain on the clothing will be collected in different way. bloodstone on the firearm. So similarly, each and every evidence, there can be the scenario with the fingerprints as well. So we need to be very careful that what is the location of the particular evidence. There are certain evidences which may not be visible. So what we need to do, we need to use UV-IR or any other chemical method which may make them visualize, and then we need to photograph them and collect them or swab them accordingly. Now, there are a number of significance of physical evidences, but what would I like to emphasize on, definitely to eliminate the innocent, to exonerate the innocent is one of the basic purpose forensic expert should be doing. What we are doing right now, we are identifying the criminal, but we are not working mainly on exonerating the innocent. There are many innocent people, those who are being caught wrongly or misunderstoodly in a crime which has not been committed by him. So we should take care of such things also. As Dr. Richa Gupta has very well established a case, it's a case where some stent has been, embedded in the body, and then so it was the negligence from the doctor's part. So there might be, so let's say, if I take this case that the proof of burden on somebody is on somebody else, but actual culprit or actual negligence have been happened by the doctor, by the medical officer. So now we need to take care of the person who were not actually involved in this crime and who have been framed or accused in such crime. So we need to take care of these things. And as the last point, you can see how many people were involved or how many people were present at the crime scene at that time. So we can check the number of fingerprints, the number of footprints, the number of footwear impressions, or fingerprints on different items. So we can identify easily that how many people were there present at the scene of crime. So evidence is very crucial, and without physical evidence, it is really very difficult to convict a suspect, even if the testimony of the witness has been obtained, or even the testimony has been obtained by the police officer, or police officer says, if there is any eyewitness also, but evidences are the one which proves or disprove the alibi, or to check the accuracy or otherwise of any testimony what has been made in front of the court. So we need to be very careful about properly collecting the evidences, handling the evidences, and sealing them. Now comes the chain of evidence. Many of the time the collection is proper, the proper container has been used, proper procedure has been used, but the chain of custody, let's say if I am the evidence collector on the crime scene and I'm handling over these evidence to somebody else without the proper requisition forms, without the proper forwarding letters, without the proper signing of that person, sign and time with that exchange. So there can be any misleading situation that can arise in the courtroom. So chain of possession should be maintained properly. Many cases have remained unsolved because of this scenario, that the evidences were obtained in an unsealed manner in the forensic lab, or open manner in the forensic lab, and then the evidence is having no evidentiary value in the courtroom, as they found that these evidences were submitted to lab in an open condition, unsealed condition, and even without the proper signature of the individual, of the professional. So we should maintain the chain of custody, and we must show to the court. It is actually happening to me many of the time when I go to the crime scene, and then when I go to the court, many of the questions are asked. There are no such questions asked that what technique you have used, what was your result. The most of the questions by the lawyers, opposite lawyers or the defense lawyers or the prosecution lawyers, are whether you have collected the evidence properly, whether you found the evidence in that way, what was your collection procedure. So most of the questions are on the collection procedure. So we must learn this properly, and we must take care of this, that we must be representing this case in the courtroom. And it is not about how much knowledgeable we are, whether we are professor, whether how much experience we have, but it is all about how we can defend our findings, how we can defend our procedures, how we can defend the protocols we have followed. So this should be taken care of. So any officer, whether so whenever you are going to any crime scene, you should take care of, you should limit the number of individuals who are handling the evidences. More the number of individuals, more will be the chances of destruction or damaging the evidence, or compromising the integrity of the evidence. And we must get the written receipt, or we must get the written signature with the time and date, everything. And the evidence should be properly sealed and secured in the proper containers as allocated to them. So the most fragile evidence should be collected first. What I'm saying here is, as per the law of progressive change, the blood or the semen, saliva, any biological fluid, even the dead body should be first, the photography should be done, and any other major evidences there should be collected, and immediately the body should be
Dr.
sent
Bhupesh,
for
last 5
autopsy.
minutes, please compile.
So these things should be taken care, and all the evidence should be must be packed in the separate containers, and the chain of custody should be maintained. Now here on this slide, I would like to emphasize, many of the experts, they become excited when they go to the crime scene. So any temptation of picking up any article should be avoided, and they should only be collected. Any item should be collected only after initial search and recording has been done. And separate containers, as I'm emphasizing again and again, should be used, and chain of custody should be maintained. So whenever we are collecting the fingerprint, we should be very careful that on what surface fingerprints are, because many of the police officers I have seen, those who are working with me, they use simple powder method, and they do not know any other method, or they do not want to go ahead with any other method, sophisticated method, non-destructive technique of developing the fingerprint on any surface. So they use the powder method and they destroy all the evidence. So fingerprints should be taken care, because these are the common most evidence which are encountered. Trace evidence should be collected, should be looked for first, and similarly the tweezers and everything. You must use the sterile tweezers and the pill boxes, the paper bundles, small envelopes, whatever you want to use, with proper sealing. And then comes the blood stain. Blood stain is another crucial evidence. So no matter what steps say you are taking, all the biological evidences are going to be degrade or destabilize over time. So any law enforcement department around the country or the world, they generally follow the best method for preservation and storage of the blood. Okay, whatever vacuum containers you are going to use for the blood, or if it is on the wall, then how you are going to photograph, how you are going to collect those evidences. You can simply use the gauze or the filter paper, which are commonly used. If the blood stains are wet, you should air dry them first, because there can be any microbacterial activity then. So I'll not go much about this. I'll go on this. The packing should be proper and secure. Each article should be separately packed as far as possible. All packets belonging to one case should be enclosed in one box. So an investigator may be handling 5 or 6 cases in a day. So one case evidences should be in one box, but in a way that they should not cross-contaminate each other. So in that way you can do. And then if you will see this, okay, I'll skip this. These are some of the forensic vacuum which we use for trace evidences. It may be soil, dust, gunshot residue, or any other particle. So you should use the forensic vacuum. See, we talk a lot, but many of us do not follow the protocols, and that's what we face in the courtroom later on. So these are simply the techniques we should be say using. Many of the time, forensic investigator have the firearms, so it should be packed like the firearm has been shown here. The complete sized container or box should be used as per the firearm which we are having. So I'll not go in much detail. So the trace evidences should be collected with the plastic zip and all. And with these words, I would like to thank the organizers for allowing me and for bearing with me for the time. Thank you very much. Any questions, please?
Yes, sir. Thank you so much, sir, for the wonderful presentation. So the next session is Mr. Donald Musho from from Zimbabwe. So the question and answer session will be included at the end of this session, sir. So,
Okay.
Mr. Presenter, are you ready, sir?
Yeah.
Good, sir.
Thank you so much.
Yeah, you can stop your sharing, sir.
Yeah.
Yeah,
Okay.
before that, I want to give a brief introduction regarding Mr. Donald Musso from Zimbabwe. So he is head of forensic chemistry at Zimbabwe Republic Police Forensic Laboratory, former head of forensic biology. He is a forensic science investigation lecturer in a police academy and a basic chemistry lecturer at Police Staff College and forensic genetics teaching assistant for second year students at University of Zimbabwe, and he is the president of GLAFAM Zimbabwe currently. So he tied with our respective GLAFAMs India, a director in South African Academy of Forensic Sciences, founding member of African Academy of Forensic Sciences, fellow of International Association of Coroners and Medical Examiners in the USA, and editor board member of the Herald Open Access Scholarly Journal of Forensic Science, which is legal and investigative sciences, and also a member of Medico Legal Death Investigators and international committee of practice in the Harvard University in US. Is going to be presenting in person at the Medico Legal Death Investigator of Symposium hosted by Harvard University in Washington, DC in upcoming June month. Okay, now I request Donald Musso to...
Okay. Thank you, sir. Right. So today what I'm going to be sharing with you guys is drug tracing. So when we are talking of drug tracing, we are talking of generating...
kindly put a slideshow, sir.
Okay, sure thing. So when we are talking of drug tracing, in other words, we are talking of drug intelligence. We are talking of building intelligence that can be used in forensic investigations. So generally, what is drug tracing? In pharmaceutical industry, this is a process of determining the product authenticity and originality so that all stakeholders can track and trace transactions at every level of the supply chain. So we are talking of the ingredients or the chemical precursors that are used to manufacture the drugs. We are talking of the manufacturing process. We are talking of the packaging, the transportation and distribution, and we are talking of the actual dispensing of the drugs at pharmacies, hospitals, and other outlets to the users, and the disposal of those drugs, and then of course the market analysis. So generally, this is the drug chain that we are referring to, but it's a bit different in forensic investigations or in forensic science. So in forensic science, it is the process of tracing a drug of abuse to see if the drug of concern is coming from the same source or same supplier. So in other words, this is where you characterize a drug of abuse, be it cocaine, heroin, cannabis, or any other substance of abuse like crystal meth or methamphetamine. You want to characterize the chemical composition or to characterize all the other features that are involved in the whole moving of that drug within the community or within the geographical landscape. So you want to have details of that drug so that at least you can be able to identify the source. So this identification of the source will be to say how many suppliers do we have in a specific geographical area, or how many people or how many geographical areas are being supplied by the same person. This will inform policing and investigations. So how do you do it? There are many methods that we have, and we are going to look at them one by one. So packaging material, this is the starting point. So generally, the methods that are used to package contrabands show a certain pattern which can lead to a source. So each gang or each particular group which is dealing in a particular drug will have particular packaging that is unique to them. This is normally because the people that deal with drugs, they focus on things that they know, they focus on things that they're specialized in doing. So they will not be changing systems, rather they stick to things that they know that they can manage and that they know that they are good at doing. For example, some may use plastic packaging or some may use khaki packaging material. So this is an example of cocaine which was recovered and it was packaged in khaki packaging material with that sellotape at the end. So this is an example of what can be done. Right. Again, this is packaging that was used to package cocaine. This cocaine was in transparent packaging material. And what you can do now is you can even go a step further and test the chemical composition of the packaging material, because khaki paper can be different from one supplier to the other. So once you take, for example, the khaki paper, you characterize it, you see that you can identify the source of that packaging material. That will then generate intelligence that will be used by investigating officers to say, this kind of person is supplying this kind of packaging material. Then that person can now help you to identify the people who are buying the packaging material. And then you can trace those people and understand why they are buying the packaging material from the supplier. So given that you already have recovered the packaging material from a drug supplier or an illegal drug supplier, you can now say that you can trace them back to their supply of the packaging material. And once you trace them back to the supply of the packaging material, you can now easily put a face to the unknown supplier. So this is what people can also do. And we have been putting that in practice here in Zimbabwe, and it has been helping us a lot in identifying some of these drug suppliers. Right. Then the chemical composition of the drug itself. You can also characterize the chemical composition of the drug because it's not an issue of just identifying the drug alone. For example, you can do a test for cocaine using the gas chromatograph mass spec, or maybe using the FTIR or the Raman spectrophotometer or the LCMS. So it's not an issue of just identifying cocaine, but you want to identify all the other impurities that are within the recovered substance, the percentage of purity or the concentration of the cocaine within that drug. So once you do that, it will help you to identify the particular source or the particular individual behind the distribution of that drug. Because, for example, if you recover a drug that is maybe 98% pure, that will show you that you are dealing with someone who is resources of the highest degree in terms of technology at his disposal. So we are looking at someone who is operating from a well-developed laboratory. So if we are having such kind of purity, where we have purity of around 98%, so the purity will tell you the person that is dealing with the drug. It tells you the technology that the person has. It also tells you the contaminants that they use or the cutting agents that they use. So those other substances that they use, you will now be able to define them. And if investigating officers have a trend of the movement of such other substances within the chemical market, they can easily investigate further to see why those people are buying such substances. If they are buying them for diluting these drugs, then they can easily have some positive leads, if they have this information from the forensic laboratory to say these drugs are mixed with chemical A, B, C, and D. So if we are going to be investigating, we should also be looking at people who are having this kind of drug or this kind of substance or this kind of precursor. It can also be used in the manufacture of this drug. So once you provide that information to the investigating officers, it makes a lot of sense to them. It brings the face of the person behind the distribution of a particular drug. So you can easily tell now who is distributing in which geographical area or how many distributors you have based on the chemical composition. Then forensic experts can also use the chemical fingerprint to investigate connections between cases. So you will discover that you can pick that this same drug, this same person has been supplying, in this case that we recovered this drug, and then in this case that we recovered this drug, this could be one supplier, just based on the chemical composition, the packaging, and the geographical distribution. It can help you, right? So distribution routes. So generally, you need to identify the geographical distribution routes or the mode of transport used by the people that are moving the contraband. So generally, you discover that a certain group will prefer moving their contraband following a specific geographical route and are using a particular specific mode of transport. Some may prefer to use road, some may prefer to use air, some may prefer to use sea or water, or some may even prefer, if it's road, you will discover that most of these drugs, you may discover them in trucks, in very huge trucks, or some in very small vehicles, or some of them may prefer to put their contraband in motor vehicle wheels. Some of them in Zimbabwe, recently we discovered drugs that were laid in a layer under a trailer of a vehicle, an omnibus and a trailer, and under the base of that trailer, there was a contraband of about 15 kgs, 15 kilograms of cocaine that was from South Africa into Zimbabwe. So these are some of the things that you may want to put in terms of drug tracing. You need to consolidate this information. It helps in terms of tracing the source of a drug and how many sources you have within a specific geographic area, and the actual origin of that drug. Then methods of smuggling. If you look at the methods of smuggling that are being used, again, they will lead you to the source, because each group will stick to methods that they know better and methods that they are skilled in using, which they know that they can be successful. And they are always particular to make sure that they don't share their method of smuggling. So a method of smuggling is something that is unique to a particular gang. So they may not share with other gangs to avoid being caught, and of course to avoid over-reliance of that method by different gangs. Because once a method is overused, naturally it becomes very easy to pick it up. So they always want to try and stick to a method that is unique to them, that they don't share with others, so that it becomes something that can not be so popular and that can evade the normal systems that are already known. So once you pick a method, you profile it, you join this with all the other information that we have discussed, you will see that it becomes very easy to put a source to a particular drug. Then eventually you can put a face to that particular drug. Then forensic drug intelligence can also be built through big data and artificial intelligence. So what we are saying here is that you can combine criminology, chemical data, and artificial intelligence, as well as statistics, to come up with methods and tools of drug tracing. So what we are saying is that you can develop an application using artificial intelligence where you capture all the information that we've been discussing. Then you can use big data to capture the statistics of occurrence of a particular drug and its chemical composition in different geographical areas. So using artificial intelligence, it can now predict new areas or where the supplier can venture into to supply the drug. It can also predict a problematic drug within your vicinity, and it can advise. You can easily now advise on policing issues or on drug control matters, given the data that will be generated by artificial intelligence. So once you capture this information, it helps to develop such systems, and it helps with monitoring previous cases that will have been unsolved. You can now see that we are having a trend of this kind of drug, and we have been failing to deal with it. Now you can see that it's one person, or it's one source, or it's one group, or one gang. And given this compilation of information on an electronic platform, you can easily share within different policing jurisdictions. And this also helps to control the situation. And it also helps to identify the number of players within the field, or the number of gangs, or the number of suppliers behind, or even the number of the downstream distributors, those ones that are being used by the main supplier or the mafia behind. So without saying much, we are realizing that we are out of time. I would have said a lot of information, but I tried to consolidate my presentation so that we give others an opportunity to present. But in a nutshell, this is what we heard about drug tracing. Thank you so much.
Sir, thank you so much, sir. It's a very excellent presentation from your side on this topic. So the question and answer we can ask at the end of session, sir. So with your permission, I request the next presenter, Dr. Oscar Manuel Hernandez Guerres from Mexico. So I will give a brief introduction about sir. So sir presenting topic on forensic dentistry as a method of human identification. He is a dental surgeon from the Facultad de Estudios Superiores Zaragoza, UNAM, Master in Criminalistics from the National Institute of Criminal Science, INICIP FGR, Master in Orthodontics and Dentofacial Orthopedics from the CEU Cardinal Herrera University, Valencia, Spain, Master degree in Health Management and Administration from the International University of La Rioja in Mexico, Master in Legal and Forensic Dentistry from Forensidad, Madrid, Spain, and the University of California, Doctorate in Forensic Science from the Institute of Legal Science of Nayarit, Mexico City campus, and he is a professor of clinical area at the Facultad de Estudios Superiores Zaragoza, UNAM, and he is a certified expert in legal and forensic dentistry by the Federal College of Expert AC. So now it's over to you, sir. Dr. Oscar, sir, you can present, sir. Thank you.
El micrófono, doctor Oscar, no se oye.
Yes, sir, you can present, sir. Sir, not audible, sir. Kindly turn off your camera, sir, otherwise.
So I think he is presenting in maybe Spanish.
Sir, but voice is not audible, sir.
Dr. Oscar, your voice is not audible to us.
Bueno, sí. Ya se oyó, doctor Oscar. Falta su traductora.
¿Sí se escucha?
Ya lo escucho.
Okay.
Dr. Victor, welcome.
So, Dr. Oscar, sir, if there is any network issues, kindly turn off your camera.
Good morning, doctor Oscar, su traductora ya tiene también el audio.
Sí, no se preocupe, aquí estamos. Lo importante es que me escuchen.
Sí, ya se escucha, gracias.
Perfecto, bueno, les voy a hablar de odontología forense, va a ser algo muy rápido, y para ello me va a auxiliar la maestra Zaira Argueta como la traductora. Muchas gracias por la invitación.
Good evening. I am thank you with Dr. Arman Sabri, Dr. Richard Wapa, Dr. Victor Gutierrez, and the organizations. I'm going to talk about the forensic odontology. It will be easy and fast. In order to do this presentation, it is necessary to help me teacher Zaira Argueta like a translator. Thank you.
Bueno, la estomatología forense va a aplicar los conocimientos estomatológicos generales para el correcto examen, valoración, manejo y presentación de las huellas de los hallazgos bucodentales en interés de la justicia.
Forensic stomatology applies general stomatological knowledge for the correct examination, management, assessment, and presentation of oral findings in the interest of justice.
Vamos a intervenir en 3 actividades como mínimo, como es la individualización, determinar el sexo, el rango de edad, el grupo racial o ancestría, establecer la probable ocupación, la probable situación socioeconómica y el probable lugar de origen. En la identificación de una persona o un agresor a través de las huellas de mordedura, la queiloscopía, la rugoscopía, el marcado de prótesis y el identoestomatograma. Y en casos de responsabilidad del profesional y demandas por lesiones del aparato estomatognático.
It is intervenes in multiple activities such as individualization, determination of sex, age range, racial group, ancestry, establishing the probably occupation, probably socio-economic situation, and probably place of origin. Identification from a person or an aggressor by prints, cheloscopy, rugoscopy, prosthesis marking, and identomastogram, and 3, responsibility from the profession and lawsuits from the injuries to the stomatographic apparatus.
Los objetivos principales, pues tenemos como establecer la identidad de los sujetos que han perdido su individualidad por las circunstancias de su muerte, aclarar problemas legales relacionados con la profesión estomatológica.
Establish the identity of the subject who have lost their individuality due to the circumstances of his death. Clarify legal problems related to the dentistry profession.
¿Cuál va a ser la importancia del aparato estomatognático?
What is the importance of the device stomatognatic?
Pues aquí tenemos un bloque en el cual fue encontrado en Ciudad de México y como podemos ver, no tenemos huellas dactilares, no presenta otro dato para identificar, pero contamos con suficientes elementos bucales para identificarlas.
This is a block which was found in CDMX. As you can see, we don't have the fingerprints, but we have enough elements to identify them.
Estos cadáveres están en estado de putrefacción. Las huellas dactilares no nos sirven. Sin embargo, los elementos bucales se encuentran íntegros para realizar una identificación.
These corpses are in a state of putrefaction. Fingerprints are not used to us. However, the oral elements are intact for the identification.
En los cuerpos expuestos a altas temperaturas también se destruyen los rasgos fisonómicos, las huellas dactilares. Sin embargo, los elementos bucales en su mayor parte se encuentran íntegros y nos van a ayudar a una identificación positiva.
In bodies exposed to the high temperatures, physiognomatic features and fingerprints are also destroyed. However, the elements or mouth parts are mostly intact, which will help us in the identification.
Estas imágenes son de una investigación que se realizó en la Universidad Nacional Autónoma de México por su servidor y son órganos dentarios expuestos a altas temperaturas, a 200 grados, 400, 600, 800, 1000 en 1200. Y como vemos, cada uno de estos rangos de calor presenta diferentes características muy propias de cada rango de edad y nos establece una temperatura a la que llega ese cuerpo humano.
These pictures are from the study that was carried out at the FES Zaragoza at UNAM by yours truly. We exposed to teeth to high temperatures in the range of 200, 400, 600, 800, 1000, and 1200 centigrade. As we see, each head range presents different characteristics, and each one will allow to establish what temperature that corpus reach for the forensics purposes.
En los desastres naturales, como temblores, terremotos, también la odontología nos va a permitir identificar un cuerpo, ya que éste pierde su individualidad por aplastamiento o por la gran destrucción de la cavidad bucal. Podemos armarlo como un rompecabezas, ya que los elementos bucales son muy fuertes.
In natural disasters such as terremotos, earthquakes, dentistry will us to identify a body that has lost individuality due to its death with dental elements. Signs deaths are very resistant, and even if we have a lot of bone destruction, we will to be able to put together as if were a puzzle, which will help us in human identification.
Un ejemplo es esta personita que fallece en un terremoto en un edificio de departamentos, es encontrada abrazada a su mascota. Lo interesante es que la mascota trae identificación y ella no. Ella presenta un estado de putrefacción muy avanzado donde ya no se puede utilizar una huella dactilar o reconocerla a simple vista por su fisonomía. Sin embargo, si podemos, como podemos apreciar, los elementos bucales, como las arrugas palatinas, se encuentran íntegros. Los elementos, los órganos dentarios también. Esto nos va a permitir una identificación positiva.
This little person dies in an earthquake in an apartment building and was found hugging her pet. The interesting thing is that the pet has identification and she doesn't. She presents an advanced state of putrefaction where fingerprints can no longer be used to recognize simply by her physiognomy. However, we can see that the oral elements and the palatal root are intact, which will allow us to identify her.
Otro ejemplo es este cuerpo que estuvo 15 días dentro de un lago y podemos apreciar la erosión que causó el agua a los tejidos blandos. Sin embargo, podemos apreciar que la cavidad bucal y sus elementos se encuentran íntegros con una gran posibilidad de ser identificado por los elementos dentales.
This body was in lake for 15 days, and we can see the erosion that the water caused to the soft tissues. However, we can see that the oral cavity and its elements are intact with a great possibility of beginning identified by dental elements.
Este es un acercamiento de la cavidad bucal y podemos apreciar la integridad de los elementos bucales.
This is a close-up of the oral cavity where we can appreciate the integrity of the oral elements.
En desastres masivos donde el cuerpo presenta aplastamientos muy grandes, el odontólogo puede volver a armar los maxilares como si fuera un rompecabezas y estar en posibilidad de llevar a cabo una identificación.
In massive disaster where the body has very serious crushes, the forensics odontologist can put the jaws back together as if it were a puzzle and be able to carry out an identification.
Este es un ejemplo de cómo vamos armando ese rompecabezas con pegamento.
Here you can see how the puzzle of the jaws is beginning put together.
En esta diapositiva también podemos apreciar los elementos como prótesis, radiografías, que también nos pueden ayudar a llevar a cabo una identificación humana a través de una confronta.
In this slide, we can see the elements such as prostheses or X-rays that can also help us carry out human identification through confrontation.
En esta imagen para un odontólogo forense es muy rica en elementos de contraste. La paciente presenta muchos procedimientos odontológicos que nos van a permitir individualizarla.
This picture for a forensics odontologist is very rich in contrast the elements. The patient presents many dental procedures that individualize her from others.
Esta es una imagen que fue encontrada en las afueras de la Ciudad de México, donde apreciamos que por la colocación que presenta el cráneo lleva mucho tiempo expuesto a la luz solar. Podemos apreciar que presenta un tratamiento de ortodoncia. Esto quiere decir que algún odontólogo tiene un expediente de esa persona. Él sabe quién es, a quién perteneció ese cráneo y su identificación se podrá llevar a cabo en una confronta de datos antemortem recabados por el odontólogo con datos postmortem recabados por el odontólogo forense.
This is a picture that was found in the outskirts of the Ciudad de Mexico, where we can see that due to the coloration of the school, it has been exposed to sunlight for a long time, and we can see that it has orthodontic treatment. This means that some dentist has a file of this person. He knows to whom this school belongs, and its identification can be carried out by comparing the antemortem data collected by the dentist with the post-mortem data that the forensic odontologists can extract from the school.
Vamos a ver un poco de la determinación del sexo.
Let's go to see a gender determination.
La odontología nos dice que el tamaño y alineación de los órganos dentarios, en sí los incisivos centrales superiores, van a ser más voluminosos en el sexo masculino que en el femenino.
The odontology says that the size and alignment of dental organs are different between male and female. Longer upper central incisor in males.
El sexo femenino va a tener los órganos dentarios más uniformes y más alineados.
The female sex has more uniform and aligned teeth.
En el sexo femenino, la segunda dentición va a ser más precoz. Hablamos de 4 meses y medio.
In the female sex, the second dentition is earlier, 4.5 months.
En el paladar masculino va a ser ancho y poco profundo, arcos dentarios gruesos. En el paladar femenino va a ser estrecho y profundo, arcos dentarios finos.
Wide and shallow male palate and thick dental arches, narrow female palate and deep, fine dental arches.
La morfología de la mandíbula en el hombre es más grande, gruesa, cóndilos más anchos, apófisis coronoides anchas y altas. En la mujer van a ser pequeñas, menos robustas y todas las estructuras, cóndilos y apófisis coronoides van a ser más gráciles.
Mandibular morphology. In men is longer and thicker, with wide condyles and wide and high coronary process. In women, it is small and less robust in all the structures, condyles and coronary process graceful.
Hay una fórmula de medición de la mandíbula, la anchura de la rama cúspide del cóndilo al plano mandibular, que es esta figura de arriba, la anchura mínima de la rama perpendicularmente, aquí, la longitud total de la distancia del punto pogonion a pogonion contralateral y la longitud total que va a ser el pogonion a elgonion, son puntos cefalométricos y multiplicados mayor a 1200 nos va a dar una tendencia al sexo masculino y menor a 1200 nos va a dar una tendencia al sexo femenino con un error del 18.4%.
Mandibular measurement. Height of the ramus scopus of the condyle to mandibular plane, minimum branch height, perpendicularity, bigonial width, transverse distance between gonions, total length, distance between pogonion and gonion. If by multiply these four measures, the product it is greater than 1,200.88 male, less than 1,200.88 female, 18.41 error.
El ángulo de la mandíbula, entre sea mayor a 125, es tendencia femenina, menor a 125, tiene una tendencia masculina.
Female more inclination, 125 grades, male inclination less, 125 degrees.
Entre más ancha sea la glabela, va a ser más hacia el sexo masculino, y entre más plana al sexo femenino. Las órbitas, entre más cuadradas, vamos a tener más tendencia al sexo masculino y más redondas al sexo femenino.
In this picture, you can see the female glabella, male glabella, and eye orbits that are very different between them.
Los paladares más cuadrados al sexo femenino y más triangulares al sexo masculino, ¿no? Las mastoides, entre más grandes sean, van hacia el sexo masculino que el sexo femenino.
Square and wider palates oriented towards the male sex, while triangular or narrow palates oriented us toward to the female sex. Mastoid presses larger and more prominent in the male sex and smaller in the female sex.
Este es un resumen de lo que acabamos de leer.
This is a review of the previous reading.
Para determinar la ancestría,
Determination of ancestry.
nos habla del tubérculo de Carabelli, las variantes que tenemos en el tubérculo de Carabelli. Sin embargo, esta ya está en desuso ya que no hay grupos raciales muy puros.
It is a disuse because there are no longer racial pure groups. There is already a lot of pure migration in Mexico.
La morfología del maxilar. Las arcadas triangulares nos dirigen al grupo caucasoide, las arcadas rectangulares al negroide y las arcadas oval al mongoloide.
Maxilla morphology: triangular arch, caucasoid, rectangular arch, negroid, oval arch, mongoloid.
Tenemos una fórmula del índice nático, que es la distancia del basion a los huesos nasales, el basion, que es este punto, a los huesos nasales, y dividido entre la distancia del basion hacia los procesos alveolares. Eso dividido y multiplicado por 100 nos va a dar, si es menor a 96, hacia el grupo caucasoide. Si va del 96 al 103, nos va a dar el grupo negroide, y superior al 104 al grupo negroide.
This is a form when you can identify a racial group Caucasoide, Mongoloid, Negroid. A Gentile index basing distances to nasal bones between distance from the basement to alveolar process multiplied by 100. This is dependent of the result. Racial group can be orthogamous, Caucasoid like a 99 mesogamous, and Mongoloid Negroid about 104 prognamut.
También tenemos la determinación de la probable ocupación por los elementos bucales.
This is determination of probable occupancy.
Estas profesiones se colocan algunos elementos, por decirlo. Para la determinación de la probable ocupación, los estigmas ocupacionales del orden estomatológico son señales particulares al aparato estomatológico debidos a factores directos o indirectos relacionados con la ocupación del individuo. Por decirlo, actúan directamente al dañar o marcar las piezas dentarias o los tejidos blandos, como por decirlo, los zapateros, los músicos, los carpinteros, los tapiceros. Estas profesiones se colocan en los dientes los clavos o los instrumentos empleados para su profesión, y estos modifican las piezas dentarias de acuerdo a su forma y estructura, y esto nos permite orientarnos en una profesión ocupacional.
Determination of probable occupancy. The stigmas of stomatological occupation are small stomatognathtic perpendicularis due to direct or indirect factors related to the individual's occupation. Direct factor acts directly by demanding or marking teeth of soft tissues, like shoes, racks, musicians, carpenters, upholsterers. These professions place nails or instruments using their profession in their teeth and modify the teeth according to their shape and structure. This allows us to find out about the probable occupation.
Tenemos como el factor indirecto manifestaciones bucales a consecuencia de la ocupación del individuo. Por decirlo, los sopladores de vidrio o fabricantes de pirotecnia, tragafuegos, presentan lesiones en los dientes por exposición a los ácidos, pigmentación azulada en los labios por la exposición a la anilina.
Indirector factor, oral manifestation as a result of the individual's occupation, glass blowers, pyrotechnic manufacturers, fire eater, injuries to the teeth due to the exposed to acids, blushing pigmentation on the lips due to exposed to aniline.
Este es un ejemplo, por decirlo, los galvanizadores o fabricantes de explosivos por el factor del ácido clorhídrico presentan dientes sin brillo, amarillos y frágiles. Los vulcanizadores, pintores y fabricantes de explosivos por la anilina van a presentar labios y encías azuladas.
This is an example. Galvanizers and explosive manufacturers, like a factor is hydraulic acid, the characteristics dull, yellow, and brittle teeth. The vulcanizadores, painters, and explosive manufacturers, the factor is aniline, and the characteristics lips and blue gum.
Para tener una probable situación socioeconómica o establecer una probable situación socioeconómica se establece por diversos factores, tales como el tipo de restauraciones, que van desde las más simples y baratas hasta las más complejas y costosas, tratamientos de ortodoncia o implantes.
Probably socioeconomic situation. It is established by various factors, such as the type of restoration, from the simplest and the cheapest to the most complex and expensive, from the amalgams to gold or shining implants or bridge in your teeth, orthodontic or an implant treatment.
Para el probable lugar de origen o procedencia, en determinadas regiones sus pobladores se caracterizan estomatológicamente por sus costumbres, hábitos, modas, ingesta de agua, etc. Tenemos los elementos ornamentales que consisten en utilizar aditamentos de ornato como oro, plata, etc. en ciertas piezas dentales sanas, con el único propósito de contar con un artículo de ornamento en la boca. Esto va más al sur de la República Mexicana. Esto se acostumbra mucho la colocación de metales con ciertas figuras en los dientes, a diferencia del norte del país, donde lo que se acostumbra son brillantes o diamantes en los dientes, y algunos inmigrantes que van de los Estados Unidos hacia acá regresan con algunos tatuajes dentales.
Probably place of origin of provenances. In certain regions, their habits are characterized stomatological by their custom habits, fashions, water intake, etc. As ornamental, consists of using ornamental accessories like a gold, silver, etc. on certain healthy teeth with the sole purpose of having an ornamental item in your mouth. So yes. In the south of the Mexican Republic, it is very customary to place metals with certain figures on the teeth, unlike in the north of the country where it is customary to have brilliants or diamonds on the teeth, or some immigrants who leave the United States and return with some dental tattoos.
También encontramos pigmentaciones dentales como el yodo o fluorosis dental, que consiste en manchas dentarias que van desde el amarillo tenue hasta el café oscuro, como Durango o Aguascalientes, que son estados de la República, también Zacatecas, donde se presenta fluorosis dental, ya que el agua contiene altos niveles de fluoruro.
Dental pigmentation, such as iodine or dental fluorosis, consists of dental stains that range from the faint yellow to dark brown, like a Durango or Aguascalientes. There are states in Mexican Republic where the dental fluorosis still occurs since the water contains high levels of fluoride.
El odontólogo, para estimar el rango de edad, ya que la edad dental es definida como el nivel de mineralización dental estimado durante el proceso de desarrollo, el cual es un indicador útil de maduración de la edad biológica.
Estimated age range. Dental age, it is defined as the level of dental mineralization estimated during the envelopment process, which is a useful indicator of manufacturation and biological age.
Estos son los parámetros que nosotros como odontólogos utilizamos. sin evidencia del folículo dentario. No alcanzamos a ver nada. Evidencia radiográfica del folículo dentario, donde apenas se empieza a formar la pieza. El tercer estadio, corona completa sin formación de raíces y corona completa con la formación de raíces hasta el tercio gingival.
These are the parameters that we as dentists take in account. 1, no radiographic evidence of the dental follicle. 2, radiographic evidence of the dental follicle. 3, complete crown without root formation. 4, complete crown with root formation up to a third gingival.
La corona completa con la formación hasta un tercio medio de la raíz, la corona completa con la formación de las raíces hasta el tercio apical y la corona y raíz completas solamente con el ápice abierto.
Number 5, complete crown with the root formation up to the middle third. Number 6, complete crown and root formation up to the apical third. 7, fully formed crown and root with open apices.
Y en 8, la corona y raíz completamente formadas con el ápice cerrados. En estas dos radiografías encontramos todos y cada uno de los estadios que les acabo de mencionar.
Estimation age through identification. Number 8, fully formed crown and root with closed apex. In these two X-rays, we can observe each and very one of the parameters that I have mentioned, from the formation of the dental follicle to the complete tooth.
Estas gráficas nos muestran radiográficamente lo que pasa dentro de los maxilares, que es lo que les acabo de mencionar, y que nosotros los odontólogos nos va a permitir establecer un rango de edad. Las figuras azules son los órganos dentarios de la dentición primaria o de niño, y las figuras amarillas representan los órganos dentarios de la dentición permanente.
This graph shows us the radiographically what happens inside the jaws, which is what we as the dentists will allow us to establish an age range. The blue figures are the dental organs of the first dentition of childhood dentition, and the figures in yellow represent the organs, teeth of permanent or adult dentition.
No nos vamos a detener mucho en estas imágenes, solamente es para que ustedes vean que cada rango de edad presenta sus particularidades muy específicas entre la formación de la dentición infantil y adulta.
We are not going to stop too much on these pictures. It is just so that you can see the age range presents very specific particularities between the formation of childhood and adult teeth.
18 años más menos 9 meses, 2 años más menos 6 meses.
18 months plus 3 months, or 2 years like 6 months.
3 años más menos 6 meses, a los 4 años más menos 9 meses.
3 years unless 6 months, and to 4 years, to like 9 months spaces.
5 años más menos 9 meses, 6 años más menos 9 meses.
5 years unless 9 months, or 6 years unless 9 months.
7 años más menos 9 meses y 8 años más menos 9 meses.
7 years unless 9 months, or 8 years unless 9 months.
Y como ven, alrededor de los 9 o 10 años predominan más las imágenes amarillas que las azules. Eso quiere decir que se va terminando la dentición infantil.
As you can see, around the age of 9 or 10, yellow pictures predominate more than the blue ones, which means that the children's teething is coming to an end.
Y aquí nos vamos a detener un poco porque el caso que viene a continuación involucra estos rangos de edad. Veamos que en el rango de 12 años más menos 9 meses, donde comienza la edad adolescente, tenemos que los caninos se encuentran en oclusión. Los caninos van a hacer esto si se encuentran en oclusión. También los segundos molares no se encuentran en oclusión y los terceros molares solamente presentan la raíz, la formación de la raíz sin el tercio, la formación de la corona sin el tercio radicular. Esto que les acabo de mencionar lo deben de tener en mente.
Here we are going to stop a little because the case that follows involves this age range. Let's see that the range of 12 years plus minimum 9 months where adolescence begins. We have that the canis are in occlusion, the second molars are not in occlusion, and have their root tips open and the formation of only the crown of the third molar without root. That what I just mentioned should keep in mind.
En los 15 años más menos 6 meses, vamos a tener todas las piezas en oclusión y los terceros molares presentan la corona y un tercio de la raíz.
In the study of 15 years, more or less 6 months, we will have all the teeth in occlusion, their apices closed, and the third molar present the crown and 1/3 of its root.
Y bueno, para el caso, la presentación de un caso, en el año 2010 fue reportada la aparición de un cuerpo humano sin vida en la zona periférica de la Ciudad de México.
For this case, in 2010, the appearance of lifeless human body was reported in a peripheral area of the city.
Y para la estimación del rango de edad a través de la dentición, al llegar los peritos de criminalística encontraron 4 bolsas de basura, las cuales contenían en su interior al parecer restos humanos. Y al inspeccionar estos en el lugar de hallazgo se establece que los restos corresponden a una sola persona. Previo embalaje de los restos fueron trasladados al anfiteatro, donde se inició de manera inmediata los estudios forenses correspondientes. El estudio por parte de los médicos estableció que los resultados podrían ser de una persona del sexo femenino entre 15 y 18 años, la cual presentaba signos externos de violencia y compatibles con heridas por arma punzocortante.
Estimation of age range through dentition. Upon arriving at this scene, the criminalistics experts found 4 garbage bags which apparently containing human remains inside. When inspecting this at the location of discovery, it was established that the remains correspond to a single person. After packing, the remains were transferred to the impeder, where the corresponding forensics study began immediately. The study by the forensics doctor established that the remains corresponds to a female person between 15 and 18 years old, who present external signs of violence compatible with the wounds from a sharp weapon.
En esas fechas ocurrían una serie de desapariciones de menores de edad. Por tal motivo, los datos suministrados por las ciencias forenses debían de ser exactos en cuanto al establecimiento del rango de edad. Como en esos momentos el rango de edad se estableció, era muy amplio, se sugirió la necesidad de aplicar un método técnica que permitiera disminuir el margen de error. La ayuda diagnóstica seleccionada para el fin fue toma de radiografías y con el posterior estudio odontológico forense de la cronología de la erupción y calcificación dentaria de la víctima.
On these dates, a serious disappearances of minors occur. For this reason, the data provided by forensic science should be exact in terms of establishing the age range. At that time, the established age range was very wide. They need to apply the method of technique that would reduce the margin of error. The diagnostic I select for this purpose was the taking of X-rays, with the subsequent forensics odontological study, the chronology of the victim's dental eruption and classification.
Se realizó la sesión de toma de radiografías a nivel de la zona de molares. En la imagen 1, la fotografía del conjunto, en la cual se observa el proceso de toma de radiografías del maxilar del cráneo de estudio. Y en la imagen 2, la fotografía de conjunto, en la cual se observa la toma de radiografía periapical a nivel de molares mandibulares izquierdos.
In picture 1, overall photo which to the process of taking X-rays of the yellow skull in the study. Picture 2, overall photograph with taking of periapical radiograph of the level of left mandibular molars.
En la imagen número 3 es la radiografía periapical, en la cual se observa la formación completa de la raíz y cierre apical del primer molar superior derecho. El segundo molar con formación radicular completa y ápices abiertos. El tercer molar con formación completa de corona solamente. La imagen número 4 presenta la radiografía periapical, en la cual se evidencian los molares superiores izquierdos con estadios similares a la imagen número 3. La imagen número 5 se observa la imagen de primer molar inferior izquierdo, segundo molar con formación radicular completa y ápices abiertos. La formación de la corona completa del tercer molar sin resto radicular. Y en la imagen número 6, la evidencia de los molares inferiores derechos con estadios similares a la imagen número 5.
In picture number 3, periapical radiograph in which formation is observed complete root and apical closure of the upper right first molar, second molar with complete root formation and open apices, third molar with complete crown formation only. Picture 4, periapical radiograph in which evidence left upper molars with stage equal to those in picture number 3 radiographic. Picture number 5, images of lower left first molar, second molar with complete root formation and open apices, complete coronal formation of third molar. Picture number 6, evidence of lower right molars with a stage similar to those in picture 5.
En la imagen número 7 tenemos la radiografía periapical oclusal tomada sobre los molares inferiores izquierdos, en la cual se logra observar la posición y formación de la corona incompleta, teniendo 2/3 del molar. En la imagen número 8 se observa la radiografía periapical oclusal de los molares inferiores derechos, en la cual se evidencia la formación solamente de 3/4 de la corona del tercer molar.
Of age range through dentition, picture number 7, occlusal periapical radiograph taken of lower left molar, in which it is achieved, observe the position and crown formation incomplete of the third molar. Picture number 8, periapical X-ray, it is observed occlusal of lower right molars, in which it is evidenced by the formation of the crown of the third molar.
La estimación del rango de edad se logró mediante la observación del patrón de la erupción dental de las piezas presentes en ambos maxilares y con apoyo radiográfico, el cual estableció un rango de edad más preciso de edad de 12 a 13 años.
Age estimation was achieved by observation of tooth eruption pattern of the apices present in the both jaws and radiographic support which establish it is a range of 12 or 13 years.
Tenemos aquí la formación de la corona del tercer molar.
We have the formation of the third tooth,
La falta de cierre de los ápices del segundo molar.
lack of closure of the apex of the second molar.
Y si vemos la cronología de la dentición a los 12 años más menos 9 meses, se establece que los ápices de los segundos molares no están cerrados. Y el tercer molar solamente presenta la formación de la corona sin raíz, lo cual es compatible con las imágenes de la persona.
If we can see, as mentioned about at the stage of 12 years or less 9 months, it is established that the apices of the second molars are not closed and the third molar only has the crown, which it is compatible with the radiographic pictures of the person in the case.
Como vemos en el estadio siguiente de 15 años, se puede presentar que todos los ápices se encuentran cerrados. Y ya el tercer molar presenta una porción radicular, lo cual no es compatible con las imágenes radiográficas del caso.
As we see, the next stage in the 15-year stage where all their apices are closed and the third molar already has root portion, which is not compatible with the radiographic pictures of the person in the case.
Vemos las imágenes comparativas de las 4 radiografías periapicales del caso y abajo tenemos las radiografías panorámicas. La derecha es de 12 años y la izquierda de 15 años.
We see comparative pictures of the 4 X-rays of the case, and below we have 2 panoramic X-rays. The one on the right is from 12 years old, and the one of the left is from 15 years old.
Como conclusión, Se pudo establecer el rango de edad del cuerpo encontrado en la periferia de la Ciudad de México y sometido a estudio odontológico radiográfico es de 12 años, de 12 a 13 años y no de 15 a 18 años.
Conclusion of the case. It was possible to establish that the age range of the body found of the outskirts of the city and the subject to study dental and radiographic is 12 to 13 years and not 15 to 18 years.
Muchas gracias. Es todo.
Thank you for us.
Thank you so much, sir, for the wonderful presentation. So you covered the entire thing in the forensic odontology very in excellent manner. So next, I would like to invite our respected patron, Club Firms India, Dr. Imran Sabri sir, for the next presentation. So before that, I would like to give a brief introduction regarding our respected patron, Club Firms India. So Dr. Imran Sabri sir from King Faisal University, Al-Azhar, presenting topic on globalization of Indian forensic medicine and initiative well marked in history of forensic medicine. And Dr. Imran Sabri sir has been working as head and forensic medicine division in College of Medicine, King Faisal University, Al-Azhar. He is a founder of head of e-learning unit, College of Medicine, KFU, King Faisal University. He obtaining his doctorate degree from Alagra Muslim University, Alagra, India, in forensic medicine and toxicology, and researched in recovery and isolation of DNA in forensic samples. He is a fellow Royal College of Physicians of Edinburgh, United Kingdom since 2019. He is an affiliated member of the Chartered Society of Forensic Sciences and forensic practitioner, the Faculty of Forensic and Legal Medicine, FFLM of the Royal College of Physicians, United Kingdom. He is an AMEE certified medical educator and adjunct faculty of Department of Medical Education at College of Medicine, KFU. He is an editor-in-chief of International Journal of Medical Justice, published from India, and peer reviewer from many scientific journals, including Forensic Science International. Besides that, he is also a member of many national and international associations, including World Medical Association, and he is a founder and CEO of Forensic Science India and Forensic India and MedBeats. So I invite Dr. Imran Sabri sir to present his delivery. Thank you, sir.
Thank you, Dr. Perumal. You have elaborated a lot. Thank you for this. I'll keep my presentation short, and basically just I want to present the idea only, okay? Because globalization. So it's time for globalization, okay? We cannot limit ourselves in our own countries. And as you know, that language is now not an issue. And in GLIFIMS, we have multi-language conferences are going on. So this is one of the initiative taken by us in the field of forensic medicine, and I am sure it will be marked in the history of forensic medicine in India as well as globally. Why it is needed? Why there is need of globalization? First is India acquiring the global position, and the global coordination is mandatory now. There are hurdles in becoming isolated. So shifting intelligence from the human being to AI, and survival is of the most connected. So the most connected person will be survive in the future. We have taken some initiatives for globalization of forensic medicine from India. First was forensicindia.com. This website was launched This is the first global website dedicated to forensic medicine, launched in 2003, October 3, 2003, and it is serving the community for more than 20 years now. So this is the website for which there are lots of things you will find on this website, and everything is free on this website. Features which are covered in the website are journals, the conference calendar. You will find associations, teaching stuff, features, forensic websites, link to all the other websites, features of some dedicated profiles, discussion forums, online teaching, and online forensic advice, legal section, and news and views section, and also some software which are related to forensic medicine. Although there is a need to update the website, but it is working. And this initiative, Global Academy of Forensic and Investigative Medicine and Science, was initiated 2 years back in order to enhance and global reach of forensic medicine from India. Vision, you already mentioned by our President of GLAFIMS India, Dr. Vijay, to uplift the status of forensic medicine, investigative medicine, and allied health sciences nationally and internationally by promoting mutual interaction between stakeholders for advancement of relevant scientific medical knowledge. So one of the mission of our GLAFIMS is globalization, to collaborate with the nationally and internationally for exchange of information and knowledge, for academic and scientific advancement in the field of forensic medicine, science, law, toxicology, criminology, etc. And to organize seminars, workshops, conferences useful for persons involving teaching and training as well as criminal justice administration, and to establish the and facilitate, promote educational institute to for forensic medicine, science and law, toxicology, and criminology. So this is the global mission of the GLAFIMS, and we have global representatives from many countries, and this is one of the list that is in front of you. We have well-established associations as well. So we have at least representative in more than 25 countries now. And various functional units which are well established is GLAFIMS India under the headship of Dr. Vijay Pal Khanagwal sir, GLAFIMS Egypt under the leadership of Dr. Abu Yazid, GLAFIMS Bangladesh under the leadership of Dr. Komodo Prasad Saha sir, who was the presenter and the guest of honor for today's event. GLAFIMS Italy, GLAFIMS Mexico under the leadership of Dr. Victor Gutierrez Olivares, GLAFIMS Tanzania and Zimbabwe under the leadership of Dr. Donald Mushovi. So these are the functional units, and now today we have established and presented the GLAFIMS Spain under the leadership of Dr. Carlos Corrado. So 8th one is coming. So GLAFIMS has a well-established website in which all the details is available, and about the vision and mission, governing council activities. I'll not go into details of anything, just since I am presenting the idea of globalization. So with this idea, I'll just end here, and when I see this picture, this is correctly representing our goal, that we will be acting like a bridge for all these, and we have a string, very strong strings, and by this, we will connect the Indian forensic medicine with the global forensic medicine like a connecting link. So with this, and we promote global collaboration. So all the association which are like-minded can collaborate with us. Synchronized approach. We believe to work in synchrony to reach maximum output, and we will work according to the mutual benefits of each other with an unbreakable bond. You can see our bond today, that all our units are very much enthusiastic and enlightened, and we work solely for the forensic, okay, and without any bias. So, and our aim is advancement of our specialty, forensic medicine. This is the idea. With this, I would like to thank you and end my presentation.
Yes, sir. Thank you so much, sir,
Yes.
for the
Thank you.
wonderful presentation about our CLUFMS and the CLUFMS motto. So now can we proceed with the question and answer, sir, for the previous sessions? Combined with all the sessions, sir, because in between we did not conduct any question and answer session, sir.
Yes, please go ahead.
Yes, sir. So I request all the participants who have any kind of questions in the previous session, kindly ask.
Okay, I think Perumal, many of since it is more than 5 hours, many are
Yes, sir.
tired so much. So I don't think that there is more questions. They have already asked, I think.
More
If
questions.